Wonderful.
All right.
Okay, definitely working.
Okay. Good morning, everyone, and welcome to the Oregon Early Learning Council meeting on April 26, 2023. And I will ask our wonderful administrator, Remy, to call the roll, please.
Yes, and so generally I would call the ex officio agency leads, but they will be coming at 10 a.m. So I am going to go through our voting council members today, starting with Angie Blackwell, who is excused today, Katie Brooks.
She will be here sometime.
Coming soon. Peter Buckley.
Here.
Thank you. Ann Kubich.
Here.
Thank you. Cleathorn Ladd. I see you.
Here. I'm
Thank
here.
You. George Mendoza.
Here.
Thank you. Dr. Peg Miller.
Here.
Subin O.
Here.
Thank you. And then we all finally we have Chair Sue Miller.
Present. Thank you. Okay. Council members, and I want to acknowledge that one of our agency directors is with us now. Alyssa, welcome. We appreciate you being here. I want to thank all of the council members at the very beginning for being willing to start an hour earlier than we have in the past. It really has given us, as we do the agenda planning, a lot more flexibility in having time for us to have exchanges and discussions with the presenters. So thank you very much for arranging your schedule so this could work. I know you all are very busy. So we're going to start today. Usually we end our meetings with talking about rules, but we're going to start today with Jordan and Kayla, who are feel like they're members of the council by now because we see them frequently, fortunately. So Jordan and Kayla, thank you for all that you're doing to get us ready to have ERDC move over to ELD in 2 months. Wow. Okay. We've talked about this for so long that it's a little hard to believe it's 2 months away. And council, you may know that we did get an email from Remy, I think early this morning, with information that Kayla and Jordan and PowerPoint that they will be going through with us. So Jordan and Kayla, welcome. Thanks for the work you're doing, and we are ready to listen to you.
Great. Thanks for having us. Let me go ahead and I'm going to go ahead and share my screen. Let me get that going here. Okay, let me know when you can see it. Good. Great. Okay. All right. Thank you for having us. Once again, we're here to talk to you about the rules transfer for the employment-related daycare program, as you are all very familiar with at this point. We're sort of wrapping up some of this this week or this month, and then next month we'll kind of have some space for questions, any clarifications, feedback. But we're hoping to get through all of these different rule sets today. As well as to talk about kind of some of the feedback and experiences of the Rules Advisory Committee that was hosted in collaboration with the Oregon Department of Human Services. So just have a quick agenda here. Here's our timeline that you're already well familiar with as well. So we have April 26th here today, talking about partner feedback, some of the details of the program. And then, like I mentioned, next month, we'll really be talking about some of those administrative pieces and then any other questions that or clarifications that might be needed.
And Jordan, excuse me, let me interrupt 1 minute. I just want to acknowledge that Claire Seguin is on our call, and ODHS obviously is an integral, incredibly important and supportive partner in this. So Claire, I just want to recognize all the work that you and your colleagues are doing, have done, are doing to help with this transfer. So thanks, Claire.
Thank you, Sue. Really appreciate that. It has been a very dedicated and pretty long journey, and we're almost there, right?
Yes. Okay, so go ahead, Jordan.
I go for it. And hi, Claire. Okay, I'm going to pass it off to Kayla following this slide to talk about some of the experience of the Rules Advisory Committee meetings.
Yeah, so Sue, great segue to Claire there earlier, because actually ODHS and ELD did a joint RAC over the last month and a half or so, going over all of the repeals that will be occurring in ODHS's rules that currently support the ERDC program. And then the new rule set that sort of pulls from ODHS's current rule set into our own. There were a total of 4 RAC meetings, traditional RAC meetings. There were those 2 information sessions in advance. And we sort of initially anticipated only having 3, but we got some feedback from a lot of our community partners that they actually wanted more time to engage with the rules. So we added that 4th additional meeting to continue the sort of administrative portions of the rule set that DELC will be adopting. So there were a total of 4 RACs, and if we want to keep clicking forward, there were about 60 participants in total, though participation in each meeting varied and sort of trickled off over time. Traditionally, ELD has a little bit of a smaller RAC, with roughly maybe a dozen members. There was no application process for this RAC. We felt that it was such a big transition and such a large rule set and so important. And the partnership with ODHS and them having, additional parties that, often come to the table, we wanted to make sure there was a very open and collaborative forum. And so we did get quite a high participation rate. We saw a lot of folks from the CCR&Rs and the early learning hubs. There were a number of individual providers on the calls and additionally representation from the unions. And then we had some folks from advocacy groups and nonprofits. 211 was there in particular, multiple folks who were sort of a steady presence in each of the RAC meetings. It was a little bit hard to discern whether or not families themselves attended. If I had to guess, I would say no. There was no sort of voice, I think, of any individual family during the actual RAC meeting. So I think that's an area of growth that we should look to achieve moving forward. But I think a little bit understandable in this sort of more technical transfer process as well, even though we do have those eligibility expansions happening. So just want to flag perhaps maybe a little bit of a gap on that side, but we can continue to work on that. So that's sort of who participated. Are there any questions from the council in particular about sort of the RAC composition or thoughts?
Did you have a couple questions I have, sorry.
No worries.
Did you have ethnic and regional geographic representation?
So I think regional, yes. And there was, I think, some variation in terms of ethnicity. I wouldn't go so far to say as perhaps we covered the whole board, but there was some diversification in terms of who was at the table, Kali.
Kayla, could you maybe explain how this process was different than our typical RAC process?
Yes, certainly. So instead of the application process, we really sort of did the same posting and the same social media engagement and sort of promotion of the RAC opportunity, but it was more of a sign up, like not first come, first serve, because everyone was able to attend, but it was really just sort of like a sign up feature. And attendance wasn't required even if you did sign up. So theoretically, you could get all the materials and all the information that we would push out to the RAC, but you weren't required to attend. And so I think it does differ a little bit in that way from our traditional RAC process. And then additionally, because it was co-administered with ODHS, they sort of have their own list serve that's been pre-established for quite some time. And so those folks sort of joined our RAC as well. And, I think their demographics are very diversified across interest groups. But I couldn't personally tell, and Jordan, maybe you have a little bit more on this, what sort of diversification in terms of ethnicity is often.
Well, without going, I think I'm just trying to get a sense. And I think that's what we're always asking for, is a representative. Is it a representative sample of our state, without going into excessive detail on each ethnic group?
And I think, Cully, typically what we would do when we have a RAC of like 12 to 15, that's information we're capturing. And if there's a gap, we then do really targeted recruitment. But because this was like a come one, come all approach, there wasn't an opportunity to say we're missing anyone. And I think, this, and Kayla, correct me if I'm wrong, this is really focused on moving the rules. And I think what we'll hear in a little bit more detail is there's a lot of feedback that we can't implement now. And so I think there's going to be more opportunity after July 1 where we can do more of that targeted and make sure we do have that representative sample, Cully. And going forward, we'll stick with our usual process of having applications that we really can make sure we've got a representative sample of folks for the rules like we do with all of our other rule sets.
Great. And the one thing I would call out, and I don't remember exactly who shared, but one of the visits I did, someone that is connected with the child welfare system very specifically talked about some of the limitations they saw with EDRC and had a lot of questions that I could not answer, but just making sure that people that have that connective point to child welfare are engaged, I think is important, because there, I guess, are some unique circumstances connected with those families. It seemed like she was a foster parent, but anyway, I would just call that out.
Okay.
Thanks, Cully. Okay, let's go forward.
Okay, just quickly, so sort of wrapping up this slide, some of the major themes were, there was, I think, a lot of general appreciation of the direction of the new eligibility changes, the sort of preserved 12-month eligibility, and the opening up of being able to receive TANF and ERDC at the same time, and that categorical eligibility for ERDC of families receiving TANF benefits. A lot of positive feedback there and interest in the direction that the program was going. There was also a lot of interest in sort of, once the transition occurs, taking a look at how the individual provider requirements to receive ERDC subsidies align with the rest of the sort of OCC licensing and regulated subsidies rules that are already housed within ELD. There is some overlap between the provider requirements in the ERDC rule set and the regulated subsidy rule set. And so I think one area in particular that, ELD internally and also the group who joined the RAC was really interested in is what can we do moving forward to make sure that there's good alignment and sort of cleaner delineations between licensed or unlicensed provider type and how they interact with ERDC. And so I think that was a good theme to be surfaced in the RAC. And that is one of those examples of, we can't quite achieve any of those reforms right now, but it's something that is clearly sitting on the table to be looked at post July 1. And then another big theme that sort of came out of the RAC was the intentional program violation administration processing requirements. There's some, I think, historical use of the IPV waiver, which is perhaps not done in a super educated way. And leads to some perhaps misunderstanding by folks who are trying to deal with an IPV that we can take a look at moving forward in terms of how it's actually processed and what education goes around what an IPV is and how it gets handled. and what a waiver means or what going to a hearing might be. And so there's, I think, a little bit of work that can be done that the community is really interested in helping us look at, and I think internally we'd be interested in looking at as well. And Jordan, do you want to touch on any other big themes that you saw or observed or heard from the group?
I mean, I think you really hit on most of the main areas here. I think what we really saw was a lot of engagement and interest in the program, not only as it's moving over to the Department of Early Learning and Care, but just as a program as a whole. And that was really, I think that was really impactful to see from our lens. And I think that just means that going forward, we're going to continue to engage with community members and community partners as we kind of work on finalizing some of those House Bill 3073 policy changes, but also any future changes, really trying to make sure that we're engaging community as much as possible.
So in terms of next steps, we're going to notice, they'll be part of the May register, and the eligibility changes around 12 months, and the TANF ERDC categorical eligibility are on track in the one system to go live on July 1st. So all of that progress is moving forward at a steady clip. The group was also really interested in sort of future engagement opportunities, especially on the front side of the design sessions around those additional HB 3073 driven policy changes that Jordan was just mentioning, namely the change to allow for all citizenship or legal statuses for children to receive ERDC. There was a lot of interest in sort of being on the front side and really talking through what will this policy look like? What are the things we need to be looking out for? How do we design it in a way that's like really, smart and open and community focused, especially given the sort of equity and sort of bias and information sharing and sensitivities that are sort of wrapped up in this policy. And so I think there's a lot of appreciation for us starting to move those conversations forward in time so that they're sort of hitting before we lock ourselves into some of those systems requirements that we were speaking of earlier in some of these council meetings in terms of what it means to do a RAC after we've had a design session in the one system. And then lastly, post July 1, really starting to look at the alignment opportunities between the provider and regulated subsidy requirements and the ERDC rules. So those are sort of the next steps, I think, coming out of the RAC engagement process and just moving these rules over generally. Some areas where we could really make some traction moving forward and the actual technical process of being the owner of the rules. Are there any other questions about the RAC? Or the RACs, should I say?
Okay, let's keep going. We're going to run out of time. We always do.
Yes,
I know,
ma'am.
there's so much to talk about.
Right.
Okay, moving on forward, we're getting into the rule set. Again, these are just high level explanations of sort of what's covered within the rules that are going to be transferring over into the DELC rule set. So let me go ahead and, sorry, I have to make my little sidebar smaller. It's blocking text. Okay, so within the ERDC program, there's something called a copayment or copay for short, and that is a portion of the childcare cost that's paid by the family. That's something that is calculated based on income and family size. And it actually was restructured in October of 2021. Previously, they were pretty high copays, sometimes as high as 34% of a family's gross income. And now the average copay is about $14 a month for a family. So it's much more affordable with a maximum copay only of $130 is the total maximum that a family can pay. So there's been some large restructures in that way. We do have to have copays in place at this time, and there's some information here. So states are required to have families pay a copay unless there are certain exclusions. So one of those is if families are earning less than 100% of the federal poverty level, which we have in our structure. If families are earning less than 100% of that amount, then their copay is waived or $0. And then also within our CCDF state plan or Child Care Development Fund state plan, states can identify particular groups as vulnerable populations and then receive federal approval to potentially waive copays for those populations. And as an example, going forward, families receiving TANF will be designated as a vulnerable population within the state plan to allow for that categorical eligibility and also to be able to waive that copay for those families. In addition to our plan to waive copays for TANF families that are receiving ERDC and those families that are earning less than 100% of the federal poverty level, families that are in a Head Start or Early Head Start partnership contracts have copays waived, families in the Baby Promise program, and then also families that are on leave from work or school. And there's sort of these terms that you'll see throughout authorized work search or authorized medical leave. One thing that we did want to note just when discussing copays and also what's kind of framed within the rules is that copays really don't increase during the family certification period, except for very, very limited scenarios. The intention behind that is to maintain stability for families. So if a family's income goes down halfway through their certification period, it's not going to go back up and they won't have to pay a higher amount in terms of budgeting. That is something we'd like to touch on. Any questions on determining copay amounts within the rule? I'm going to go ahead and go forward then. This is just an example here of a family group of 3. All of the copay charts are done based on income and family size, and they follow the same tiered structure. So a family group of 4 would also have similar dollar amounts listed here. Sometimes there's a little bit of variance, like $60 instead of $50. And you can find those charts online as well as within the rule. But basically, the intent is that, for each of these income areas, which are loosely tied to federal poverty level, that a family knows and can easily understand how much their copay amount would be. And also that providers can easily understand when they're explaining to families who might be interested in the program, hey, if this is what you're earning monthly, your copay will probably be, $5 a month. Instead of before, it used to be quite complicated. And there wasn't really a way to predetermine how much that would be outside of using an online calculator.
I think it's also worth noting, Jordan and Council, you'll probably remember copays used to be significantly higher than this. So, way higher than these numbers. So this has been a huge transformation, I think largely driven by COVID and federal money coming in so we could reduce the copays. And ODHS being super supportive of pulling these copays down to a manageable level for families. So this part is amazing.
Well, something too that I kind of want to touch on is that, in the past, copays were so high and sometimes cases would be denied because the amount that the state could pay would be less than the family's copay amount. And so the benefit never really impacted the family. So especially with these families that maybe are on the higher end of earnings within the program standards, but still struggling to make ends meet, a lot of times the program wasn't serving them. And so effectively our, income, our exit income level was kind of a lot lower just because of the nature of how copays were previously structured.
Okay, thanks, Jordan. We can keep going.
Okay, the next piece of rule is around childcare need and authorized childcare hours. I think we've touched on some of this when we were talking about non-financial eligibility, but just as a recap, families can qualify for employment-related daycare if they're working or if they're in school. It used to be that they had to be working and in school in order to qualify as a student, but now non-working students also qualify as of January of this year. And then starting July 1st, families that are receiving TANF benefits will also qualify for ERDC. We have some loose definitions here. it's a little more concrete within the rule itself, but working means that they receive income from employment. That also can include federal work study as well. And then in school means working toward a GED, high school diploma, or working towards a degree or certificate in a school of higher education that's eligible to receive federal financial aid. There's no minimum number of hours that a family must be working or in school to qualify. So even if they're, working for only 5 hours a week, that's fine, they can qualify. And we'll kind of get into how that works in the next slides.
And I know the council knows this, but just in case anyone, is tuning in and hasn't heard about the TANF benefits expansion on July 1st, TANF, folks receiving TANF do not have to be working or in school to get ERDC. It's just that they must be receiving TANF benefits. So the work or school requirements do not apply. And they're going to be given a part-time authorization. And if they would like to request more hours because they need more hours, whether full-time or greater than full-time, they may do so. The only reason they wouldn't get more than a part-time authorization is if they're requesting more childcare hours to secure a full-time slot in a childcare facility. Otherwise, it would be approved.
So all of these are qualifying activities working in school or receiving TANF benefits, and these establish the childcare need for the family, and that's used to determine their number of authorized childcare hours, which is sort of effectively how the program issues out those vouchers to childcare providers. So families are given a number of authorized childcare hours, and that's based on that qualifying activity or childcare need. We've made changes in January, which I believe we already spoke on, which is approving either a part-time or full-time allocation. And then if families need additional hours on top of a full-time allocation, they can request that. We have a table here that kind of explains how the program works, which is kind of based on the number of verified weekly need hours, school or work. This is for standard ERDC, not for that categorical eligibility for TANF families, just to be very clear about that. So if families on ERDC are working or in school 1 to 20 hours per week, then they receive 20 hours per week of childcare hours, plus an additional amount for travel time of an additional 25%. And that goes into a part-time kind of monthly allocation in terms of what their provider could bill. Additionally, if a family is working or in school 21 to 40 hours per week, they get a 40 hours a week voucher with 25% travel time, and that comes to a full-time allocation. And then anything above that kind of matches the need that's specific. So if they have additional travel time that they have, or if they have overtime activities, that would be specific to whatever their need might be, up to 323 hours for the month. Students also have study hours added on to those authorized childcare hours, and that's 5 hours per week for part-time students and 10 hours per week for full-time students. And like I mentioned, for this table really is specific to standard ERDC, not for those families that are accessing ERDC categorical eligibility through receiving TANF benefits starting in July. And like Kayla already mentioned, those families don't have school or work requirements at all, or even jobs plan engagement. There's no requirements of them to secure that childcare slot. They're automatically given a part-time allocation. And then if they request additional hours, then a full-time allocation can be given, with the exception of that very specific situation that Kayla mentioned.
Also, speaking of specific situations, something I think we just want to make sure you're aware of, the TANF ERDC categorical eligibility expansion will cover nearly all potential TANF families, because we don't yet have a way to track the funds for children who have an undocumented or citizenship or legal status that is not CCDF compliant. If a family that is receiving TANF benefits has a child that would not qualify under CCDF rules, they would not be eligible for ERDC Cat-L until that change request that's due in the spring of 2024 comes to fruition. We're planning for how to address that. there are currently no TANF families in this category that are currently receiving childcare benefits. That's not to say there aren't some in the broader TANF population, but there is a small gap. We're making sure it's being messaged accordingly. We're doing what we can to address the interim period from July 1 to when the additional change request becomes effective, but did just want to call that out because we want to be transparent about that. And that this is a really significant expansion, and we think we're going to cover many, many, many families, and we're not expecting to see sort of a gap in this area, at least immediately, but did want to call that out for the council.
Kayla.
Okay, let's keep moving.
Yep. Moving on to provider payments. So if a family is eligible for assistance, essentially how things work is that DELC will pay for their authorized childcare hours, and those payments are made directly to a chosen provider through the direct pay unit or DPU. And then the amount that DELC will pay is based on the child's age, disability if applicable. That's because there is a rate called the special needs rate that is paid at a higher level, as well as something called the high needs rate, which is paid on top of the special needs rate, depending on the level of care. Location in Oregon, the type of childcare, so different childcare provider types, registered family, certified center, standard family, kind of all the different categories that are prevalent across our community. And then how many hours of care are needed. So every month providers would send in a billing form with all of this information, and then they receive payment based on that. Providers have to complete a childcare provider listing form to find out if they can be listed and approved as an ERDC provider. This lists them within the system, and then it also makes sure that they're meeting CCDF requirements, including training and passing background check. And I'm going to keep going.
So quick question for you, Jordan, if you'll go back to that former slide. So since we know all of Oregon is a child care desert, I'm just wondering the location in Oregon, what is that a rural urban divide, or how's that defined?
Yeah, so and we'll kind of get into the provider rates that hopefully will clarify some of this, but that location piece is speaking to different regions as defined within the market rate study. And so that's a study that's conducted through our partners at Oregon State University, and they compare what providers are charging in different areas of the state. And then they conduct analysis, and the actual rates themselves are done through the bargaining process with that as a tool. So yes, right now there are technically 3 regions, A, B, and C, but B and C pay at the same level. So there's really just 2 regions in terms of what those payment allocations look like. Regions A and B. And at this time, a lot of that is based on population, but it's really based on what providers are charging in those areas.
Okay, and you said we're going to see more of that in a future slide.
Yeah, there'll be a little bit more
Okay.
explanation, and there's also links if you want to look at what those specific zip codes are, because it kind of breaks it down by the different areas within the state, but really specifically zip codes.
Yeah, and if it's okay, if I just want to add, a lot of this is part of that federal CCDF framework, and it was really, the CCDF framework was really designed to answer the question with the voucher that a state is providing a parent, what percentage of the childcare providers in that community could the parent access with that voucher? So that's a lot of what this framing from the federal CCDF requirements is intended to address.
Interesting. Okay, thanks, David. Okay.
Great. So as we mentioned before, payments are made on behalf of eligible families to their listed and approved ERDC childcare provider. We sort of have a little graphic here that explains the process. The childcare provider and the family are both approved and eligible. When both of those things happen, then the family's case can be connected to their provider within DPU's system. Billing forms are issued with the family's authorized childcare hours and copay. And then the provider can submit their billing form at the beginning of each month for the number of hours each child is scheduled to be in care. The payment is made to the provider by the department, and that can happen either by check or direct deposit. And billing forms continue to be issued each month that the family is eligible and connected to that provider. So that's sort of a high level view of kind of what the process looks like. And then, as I was mentioning, speaking on provider rates, so payments are kind of made to formally set provider rates per child in terms of how the provider is billed and the family's number of authorized childcare hours. As I mentioned before, these rates are informed by the market price study, which is conducted by the Oregon Child Care Research Partnership through the Oregon State University, and are used within the bargaining process with the child care provider unions to set rates by child age, provider type, and regional area. And the market price study is one of the options that states have to conduct kind of how rates are set within CCDF requirements. States can also submit a proposal for an alternative rate methodology, which Oregon is pursuing at this time, but that work is still being conducted. And then, as I mentioned here, and you should have copies of these slides as well, those rates can be found online, currently on the ODHS website. And then as we are establishing the new DELC website, we'll make sure that you have the updated links.
Okay,
And these will also be outlined in bold.
got it.
Yeah.
Okay. Any questions from council members on rates before we move on? Nope. Looking good. Okay.
Great. There are some provider requirements. They're quite lengthy because there are certain requirements within some of these areas, like within required trainings, et cetera. They have to meet all DELC provider requirements, which that is asserted to on that childcare provider listing form. There's just a bunch of boxes that says, do you meet this requirement? Yes or no. A lot of that is around health and safety. And those are governed by CCDF requirements. Passing a background check, and then taking required trainings for license exempt providers. Licensed providers already have taken those trainings. And then becoming listed and approved is just the kind of physical mechanism for being able to be connected with the parent within the system.
Okay, any questions, council? Okay, background checks. Yeah, we've heard about these.
Oh, yeah. Yeah, so every provider must undergo a background check. And again, this is part of CCDF requirements that providers do have to meet these requirements. The first one is an FBI fingerprint check, a search of the state criminal and sex offender registry, where the individual lives, and also each state where the individual has lived within the last 5 years. A search of state-based child abuse and neglect registries, again, in the state where the individual lives, but also within the last 5 years. Search of the National Crime Information Center and of the National Sex Offender Registry. So providers go through all of these, and then they are able to be approved on the background check side of things.
So Alyssa, if you are on and can, could you give us a quick update on background checks, just in general, since we've all had calls from people historically about the slow process? How are we doing?
Yeah, I would say at this point, we're officially out of the backlog. So in the last 6 weeks, yeah, on average, about 77% of all new applications are being approved in 4 weeks or less. And 67% of all new and renewal applications are processed in that time frame of 4 weeks or less. And so we're still working through some of the older renewal applications that kind of got caught up, but programs who are renewing, as long as they submitted their application within 2 weeks of their CBR expiring, they're able to continue working in the program. And we've also created a new legislative key performance measure that we're proposing around the CBR timelines, so that we are able to really report out and kind of continue to be accountable to what those timelines are, and kind of convey any additional needs for staff and capacity going forward.
All right, congratulations, Alyssa. I know that means you moved some staff around to fill in empty slots and here as you staff up for DELC. I'm sure that's one of your priorities, but thank you.
Absolutely. We're excited and we've got a great team working on this.
Yeah, super. Okay, thanks.
Can I ask
Fantastic.
a quick question?
Yeah,
Alyssa, has communication gone out to all the hubs around some of these updates and status? Because I, even this month, have heard complaints about wait times. So I'm wondering if there's just been a mass communication so people are aware of what you're saying.
We've been sharing these updates at kind of our various tables, but we can definitely put out a mass communication. What we've been telling folks too is if there is anyone who's getting caught up, to have them reach out to us. I'll say where this varies is if somebody lived out of state, particularly if they lived in a state like California, where we're actually not hearing back from the state, then that background check is going to take a lot longer than those 4 weeks. So we've been asking folks to contact Alicia Gardner, our childcare director, and what we've been doing is kind of routing and tracking those folks down and seeing what's going on. What we've been finding in most of those cases is either they're out of state or we've actually been waiting to get information back from the applicant and they missed the email or whatever it was. So we're really pushing folks to please contact us if they've been waiting and it's been more than 4 weeks. But we can definitely work on a revisiting our communication strategy.
yeah. Okay, great question, Kelly. And we can probably use the Children Institute's coalition to push some of that out as well. Okay, next.
Great. This next slide here talks about some of the health and safety requirements. And again, all of this is outlined within rule. ERDC providers do have to meet certain health and safety requirements. That includes site visits, training, and background check, as we talked about. And all of that is per CCDF rules for subsidy providers that are receiving funds through CCDF funds. We do have a full list of these requirements by provider type, licensed, license exempt non-relative, and license exempt relative providers within the rule set that you should receive or have already received. And those really are outlining, because there are so many specifics for each provider type. I know that Kayla mentioned, some of the feedback that we received during the RAC is really to try to look at aligning some of these requirements as much as we can across the licensing standards as well as subsidy requirements. And so that is something that we'll be working on, following July 1st. And then payment can be made to a listed and approved provider who's completed the provider listing form and met all of the requirements. And we kind of already talked about this with that graphic, but it's at that point that the family's case is connected to their provider. And then billing forms are issued from the date of the provider's approval or the date of the family's ERDC approval, whichever one is later, basically at the point that both the provider and family are eligible. Are there any questions? Okay. This brings us to the end of this presentation around kind of the last bit of the programmatic rules. And like we mentioned, next month, we'll be going over some of the administrative pieces like hearings and overpayments, but there also will be a space for council members to provide any sort of feedback or additional questions that we haven't already covered. That being said, though, if there are any other questions, we're happy to answer them now.
So Jordan and Kayla, I assume there's no more RAC involvement, correct?
There is not.
4 of them were, okay.
Yep. So the RAC's closed. We did send an email about the fiscal and equity impact statement. Just if anyone had any feedback, that's due back today from the RAC. And like I said, the rules will be part of the May registry. What you will, I think, hear from us next council meeting is a readout on the public hearing that will accompany the notice of the ERDC rules. And so there may be additional comments that generate themes on where additional sort of revision or tinkering or forward work might live.
Okay. So just to be clear, at our May meeting, we'll sort of be wrapping up questions,
Yep.
any additional information that might have come in. And then the expectation is that we will actually adopt these rules at our June meeting. Okay.
That's it.
Okay. Wow. Okay, council, any last questions of Kayla or Jordan or Claire about the ERDC presentation? Okay, thanks, you guys. You do a great job with very complicated information. And I want to thank Claire again. I know that you specifically have been a huge partner in getting us to this point, Claire, as well as your colleagues. But I know everybody at ELD really appreciates you a lot. So thank you. All right, super. Council, you know, it worked. We did have more time. We could actually ask questions and have an exchange with Jordan and Kayla. So thanks for starting at 9 so we could do that. As you know from our agenda, we have panels today, which are a very exciting part, I think, of sort of what the council's been doing for the last several months. And as we head into our first panel with some of our fabulous hub directors, I'm going to ask Peter if he would provide a quick follow-up from our business hub, which you'll recall was last month or recently. And so, Peter, would you like to provide an update on that?
Certainly. Thanks, Sue. So Renee Brandon's on the Zoom here. She's our Early Learning Hub director. Renee and I were able to meet with Joff at Dutch Brothers. If you recall the panel last month, he was very passionate about the issue of childcare, and I suggested that he might want to get involved with the hub. And he was very happy to take a meeting with us. So we met with him. And Renee can add to this any comments she has on it, but my takeaway from the meeting was he's tremendously committed to this issue, feels very strongly about it, and he believes that it does going to require business leaders to be the voice. He thinks people in early childhood, while we're passionate about the work that we do, we're not going to be the vehicle that people are going to listen to. He does think that he and other business leaders need to step up. He's willing to do so. He confirmed he would make sure that the issue of childcare was on the Oregon Business Council's agenda consistently, and that he would be a strong voice. He plans to follow up with us and continue to be engaged, and with definitely other CEOs in our region, but also across the state.
Awesome. Renee, do you want to add to that at all? I know you were involved in that meeting.
I don't really have much to add. It was really a great conversation. And yeah, he made it very clear that early learning folks are too nice and polite and that we really do need a business champion to make that call to action and that sense of urgency on our behalf. And I really appreciated his willingness to partner.
Yeah,
he was impressed. Renee had went through the data of what it looks like in Jackson, Josephine counties in regard to access to childcare, and he was kind of blown away by the numbers because they are horrible, like they are everywhere in the state. And I think one of his takeaways is we're not screaming loudly enough, and that he wants to help us scream louder.
Well, welcome aboard, Joff. We're delighted to have him as a partner. And the other follow-up from the business panel, you may remember Sherry Dunn was on the panel from Portland, I think a friend of Kali's, if I remember correctly. And Sherry co-chairs the Workforce and Talent Development Board, which is a part of HEC. And so Sherry had that board director reach out to me a few days ago saying they would love to have a presentation from the council at their exec committee meeting in May about workforce issues for early childhood, and not just within DELC, but OHA and our partners. So what is the need and what's going on in workforce development? So great follow-up from some of our partners there. So thank you, Khalid, for pulling that panel together, by the way. Okay, so let's go to our hub directors. I want to thank the 4 of you for being willing to represent hubs et al. I think we all know we've seen these hub directors many times before, thankfully. So Renee Brandon from Southern Oregon, whom I know works with Peter a lot. Dorothy Spence, Northwest. And yeah, Dorothy and I have connected on a variety of issues. And let's see, do we have Kelly? There's Kelly Poe from Eastern Oregon. Welcome, Kelly. And I'm guessing Begonia will be with us shortly, and she is from Washington County. So Council, just to remind you what we've asked all 18 hubs to do is to do community outreach for Raise Up Oregon updates. And their response has just been remarkable. We owe a real debt of gratitude to the hubs. And you can tell just from these 4 samples, the amount of community outreach that you all have done on behalf of making this plan really a living, accurate document is remarkable. I looked at the demographics that the 4 of you gave to the council. And it's just incredible. So thank you. I know that doesn't happen without a whole lot of work. What staff did is they asked to make sure that we had all 6 sectors represented in these outreach efforts. Staff asked each of the hubs to pick an area that they would sort of have their primary focus be to try to get input. And so, as you know from the information in our packets, Begonia focused on health, Renee housing, Dorothy K-12, and Kelly human services. And as we also know from the notes in the packet, no one service is a silo, so they all kind of blend together. And I'm sure you all got lots of input that was the cross-sector work that we all know is what makes a system. So we're prepared to know you're not going to stay in a silo, and we welcome the fact that you won't do that. And I told the hub directors to be confident that we have a very compulsive council, so we will have read everything that they gave to us. So we didn't need them to repeat that. And instead, we asked if they would respond to 2 different questions. So I'll throw one out and then ask the 4 of them to respond. And then we'll have some time for council to interact with them. And then I'll throw a second one out. And basically, we're focusing on now what do we do? Where's the implementation happen with this plan? So with that as sort of a perhaps long introduction, let me start with the first question. And we've asked each of them to take about 4 minutes to respond to the question, and therefore leaving about 15 minutes after each question for us to interact, throw out our own ideas, ask other questions of them. So once again, thanks, Renee, Dorothy, Kelly, and Begonia when you join us. First question, based on what you learned during the engagement sessions, much of which we have in our packets, what advice do you have for us, the council, in responding to the feedback that you've received? So in 4 minutes, I know it's a little crazy, but it is what it is. So just order that you're listed on the agenda, which I think is alphabetical. Renee, how about if we start with you?
Great, thank you. Good morning. The question was broad, and so my reflections are also a little bit broad. So I welcome questions, clarifying questions if needed. One of my reflections was that we really need a housing continuum. We have a lot of resources available. Well, we have not a lot. We have resources available for folks that might need inpatient treatment, shelters, transitional housing, affordable housing, and even some programs that support that goal of home ownership. But we don't have a system that is really thoughtful when a family is transitioning from one of those housing supports to the next one. And oftentimes there is an arbitrary timeline that person has X number of months to kind of complete their program, for example. And then when they do well enough, the reward for doing well enough is they lose that housing, they lose that stability. And there isn't necessarily a next clear step that leads to more stability. And so sometimes that ends up being this revolving door cycle of going back into services just to get stability again. And so we heard that from both our partners and our families. And so that that thoughtful housing continuum is definitely needed. And then just an awareness that families are really facing more complexity than they ever have before. We have fewer access to childcare, more children experiencing dysregulation and trauma, the cost of everything increasing for families. And so any policies or practices really should be through that trauma-informed lens and really be family-centered. And family voice driving those thoughts, those changes in policies. And then the awareness that housing alone is really not enough to increase family stability. And we heard from our partners, our housing partners and our families that having that navigator, especially for our most vulnerable families, those navigating recovery, those getting custody of their children back, all of those folks really would benefit from someone coming alongside them and helping them navigate those next steps. And then, the families are really happy to be asked, how's it going? What are your thoughts about housing? And I think we need to continue to engage them. I don't think that a series of listening sessions is enough. I think that as the continuum of the housing continuum is being refined, that we would continue that feedback loop with families and make sure we're on the right track. And then finally, let families know that when progress is being made. We had a couple of folks say, these are great goals, but we don't think government's actually going to get there. And so we would really like that continuous message that we heard you, we valued your feedback. These are the steps we're taking. And we will continue to ask you as we make progress. So those are some of my reflections on the housing sector.
Wow. Thank you, Renee. Very, very informative. My goodness. Okay, we'll keep going through. And Begonia, welcome. Hi. Welcome, Begonia. Thank you.
Hi.
Thanks for joining us.
Thank you for inviting us today.
Yes. So council, as I said at the beginning, Begonia was asked to focus on the healthcare sector. So Begonia, I'll ask you the same question. Based on what you learned in the engagement sessions, what advice do you have for us, the council, in responding to the feedback?
Yeah, absolutely. Based on what we have learned, this is the advice from both the parents and the professionals that we actually convene regarding the process. So we are going to focus on the process. They actually mentioned that they should be kind of like working at looking at the aggregated data by sector and then bring that feedback and recommendations to each of the sectors. But finally, sitting down together to analyze the trends of data across sectors, because what families keeps repeating is like, we are looking at the process in a silo way, silo fashions, and all the sectors are intertwined in terms of like the issues that we are experiencing. So if you analyze trends of data, you can maybe break silos, you can compare and look at common threads or nuggets. You can understand what feedback will inform the draft of Raise Up Oregon. They actually want Raise Up Oregon to have real life examples that will result in important systems change and will be part of the strategic plan. That real example answer or concern was connected to how do parents and community partners see the success and impact of Raise Up Oregon? For what we notice is there's a huge disconnection between the community at large and the plan. So there has to be some kind of like strategic storytelling that is very important to tell, like feedback from parents and providers is that the plan is very abstract. It focuses on strategies and goals, but they cannot really see the impact of Raise Up Oregon across sectors because they are missing those real life examples. But where can they see what it was accomplished collectively during the previous biennium or the Raise Up Oregon version? There's not a place for them to go and see the outcomes and the successes. And then they also have the question like, what is still missing and why is it still missing? And how do we measure that success of the cross-sector collaboration and work? So this is basically the feedback that they provided to us. There's a lot of work around storytelling. So you asked me to come here, provide feedback. Now what?
Right. Oh boy, Council, we faced that in our own listening sessions, right? So this is a recurring theme. Okay, thank you, Begonia. Next, we will ask Kelly, and she was asked to focus on human services. Welcome, Kelly.
Good morning, everyone. So my hub board met on Monday for a work session in addition to our regular board meeting. And we used the regional assessment method for identifying root causes. And then we asked if the strategies in our work plan are the right fit to impact those root causes. If we don't know what the root causes are first, we won't know if we're making a positive impact. So my hub board has the following 3 recommendations. And the first one is really regarding root causes. Based on our engagement sessions, we believe that the council needs to go back to the Raise Up Oregon plan and identify root causes to the issues to all the engagement sessions. Just as my board did on Monday, the council has the opportunity to evaluate the impact of each strategy that you're recommending on the root cause. And I'll add to this recommendation that ideally, council members will visit as many local communities to see firsthand what the root causes look like, rather than just reading about them on paper. Kali visited Ontario and Baker City and Enterprise in 2 different visits recently. Hillary Mankowski, our hub manager, visited Ontario last October. So now both of these people have personal connections and insight when they read about these communities. And I assume George knows quite a bit about Eastern Oregon as well. So the second recommendation is they call them super navigators. So we all know every county is different. Even though we are neighbors, solutions cannot be the same. We need a system that allows local communities to identify local resources and a streamlined system for families to access the resources. We need a local person. And then they said, well, it might not be an actual person, but it needs to be so local and so relational that it feels like a real person. The board was very clear that they don't want an expansion of people or phone numbers that are hundreds of miles away. Families and community partners voiced a lot of frustration with the coordination of services. They want a person that they can relate to. But we need your support and a closed loop referral system. It needs to be a local system, but it needs to have support from the state. And the third recommendation is the pyramid model statewide. So we're recommending that the Early Learning Council utilize the pyramid model benchmarks to quality statewide as a solution or a framework or a strategy that will impact the root causes. Malheur ESD, the Eastern Oregon Child Care Resources, and now the Eastern Oregon Early Learning Hub are all at different stages of implementing the benchmarks to quality, either program-wide or region-wide. We heard over and over in our engagement sessions about workforce challenges, staff turnover, staff burnout, lack of skilled workforce, and more. The base of the pyramid model is workforce development. So I'll tell you three benefits of using this framework. So we create systems and policies that promote and sustain the use of evidence-based practices to get to the root causes. Using the pyramid model promotes positive social and emotional development, addresses challenges behaviors, and it uses the trauma responsive practices. It also, thirdly, uses culturally and linguistically relevant practices locally, regionally, and statewide. One of my board members, who's economic development director, he's always reminding us about the ROI, the return on investment. The pyramid model is a proven investment in early childhood system building. If you haven't heard about the pyramid model benchmarks to quality, please check it out. The National Training Institute on Effective Practices was held earlier this month in Tampa, Florida. There were 40 people from across Oregon in attendance. Some child care research and referral, some early childhood special education schools, preschools, and others. The conference is designed to provide professionals with an in-depth, intensive learning experience around the pyramid model framework for addressing the social and emotional development and challenging behaviors of young children. And that's my recommendations, and I'm probably out of time.
You're on mute, Sue, so we can't hear you.
Sorry. Thank you, Kelly. You certainly have a lot to learn. Dorothy, we would love to hear from you, and we asked Dorothy to focus on the K-12 education.
Thanks, Sue. And it's hard going after three of your other colleagues who are touching on many of the same points that I'm going to touch on as well for the K-12 sector. I think one of the things that stood out to me in my conversations, both with parents and with partners, is that it felt like to them, they were kind of repeating the same things that they have been saying over the course of time. And so similar to what other hub directors have already shared, I think it's really important when responding to the feedback to help reconnect our local communities to what has happened, what progress has been made, but also acknowledge where there are just system barriers continuously. And so because I had public education, the disconnect between K-12 and the early learning division, soon to be DELC, continued to come up and manifest in ways that create inefficiencies for actually operating preschool programs. So our K-12 folks in particular continue to bring up things like navigating background checks and two different systems when you're inside of a K-12 environment. But also like inclusive spaces came up across parents and providers and trying to figure out the best way to create more inclusive spaces. And we know like EIECSE lives within inside ODE, but we're creating early learning inclusive spaces that are often also overseen, or childcare community environments that are overseen by DELC. And so we continue to kind of bring up in conversation that these two systems still continue to struggle to communicate to one another. And I think it's been hard for folks on the ground to understand where there's been progress in building bridges across those two sectors. So I think that's really important to acknowledge where there's been progress, but also acknowledge that like, hey, we still have a disconnect and we're working on it. I think in terms of like the process in which response happens, and Kelly brought this up really articulately, is having the council connect with our local communities. And it doesn't mean every single council member has to go to every single county in Oregon, but there does seem to be a disconnect between kind of what our local communities understand is the Early Learning Council and Raise Up Oregon. And so being able to like see what's happening in community, but also community to see the council members and understand what's happening at the state level, more than just through the avenues of early learning hubs, I think would be really powerful. I think I've shared this idea with Sue before about kind of connecting with family leadership councils and governance councils and partner groups is such a powerful way to understand local communities, but local communities to also feel connected to the work at the state level. And then the last thing I would bring up that has also been shared is folks kept asking, now what? So what does it look like to continuously engage our local communities and help them understand, okay, here we're at the end of year one. This is what happened. This is what we have planning forward. What is that? How does that resonate with you all? Are you feeling this progress on the ground? And if not, why not? So really that continuous engagement with hubs and with our local communities is something that I heard from local partners and parents in particular is, will we have the opportunity to continue to provide feedback, continue to guide this work? Yeah, that's what.
Wow. Okay, thank you, Dorothy, and Kelly, and Begonia, and Renee. So council, you can all go off mute and dive in with questions, responses, additional thoughts, wherever you might start.
Thank you everyone for coming here and providing us with this insight. And something I'm just building on what Dorothy was just saying, I was recently in Washington County working with a group of bilingual providers. And when they learned that I was on the Early Learning Council, there was an infusion of energy into the room, a lot of comment on what they wanted to see and what they felt strongly about. And so just building on Dorothy's point, I think people are wanting to interface with us and talk to us about the way they're experiencing the system. Something I'm noticing in many of the kind of recommendations or ideas put forth to us is that there's a strong benefit to having a person who is very aware of the systems, how they work, what are kind of the ways to navigate them. There's an idea for a navigator type of position. There's an idea for, and part of that is an awareness and understanding of the systems, but also rooted in the community, that they have a strong understanding of what's going on within the context and the relationships they're in. And so something that I've heard in the past for people who have had kind of similar types of positions, such as family engagement liaisons or specialists, is that they are overtapped. There is such great demand for them, and that's a position that even if it does get funded, it is often under-resourced. I'm curious if that has been your take, and if that is what you think, and what you believe to be what is actually needed in terms of navigators and liaisons and people who can support families.
Great question, Subin. So the directors, I'll just let you jump in as you want to. I would just tag on to Subin as you respond. I'd love to know what agency is providing the navigator, if you have one. Yeah. So who would like to?
I can jump in.
Yeah.
In terms of the housing sector in particular, our partners shared that the workforce shortage has really impacted that role with partners, and being able to access peer support specialists to do some of that work as well. And so it does sound, from the partners we spoke with, it does sound like they had most agencies had their key person who was kind of that go-to person, was under-resourced. And now the need has gone up and the resources have gone down, and there really is a struggle, and it's our families who are bearing the burden of that. So that was definitely, I would say, an elevated need and priority from our housing partners. And it also came up as a theme for the families who had benefited from having someone come alongside them. So I'm not sure I've been specific enough for you. The housing sector, I learned through the listening session, not a housing expert here. So, but yeah, the need is very strong, and the resources are not.
Okay, thank you.
I would say for Washington County, parents actually thought that the process was very silo, because what we hear really clearly and really loud is basic needs are not met, and basic needs were around housing and childcare and education and many other things. So one of the things that maybe we could be looking at is a hybrid system. So one is a not wrong door system, and the other one is like more like boots on the ground, because not all families are like happy approaching a no wrong door system through a phone call or Zoom discussion or whatever platform. And some of them are more relational, so more like the boots on the ground. But one of the challenges that we actually have family resource coordinators that are bilingual. We have home visitors, we have community health workers, but we speak 110 languages in Washington County. The expectation that we could be serving all of them with the existing funding and with the workforce issue is not realistic. So that's why we have to set priorities to see, okay, out of the 110, who are the ones that we could be serving now? And it's a tough choice.
And I just wanted to respond real quickly to the agency question. Sue, we don't necessarily have a navigator type of position like that in our region, but I think that it's hard to say what agency could provide that, especially with the local context. So one of the pieces being like, every community has a different, like it's the right person sometimes in the right agency that has the right level of capacity that winds up being the best fit for that kind of position. And that's so hard to predict, right? It could happen in many different places. You have to have that person who has the right mindset to support, families. And I think similar to Begonia, it's really hard to build that across a diverse community, right?
Yeah,
and
I think the only.
Sorry.
Go ahead, Begonia.
Just gonna give a super quick example of partnering with an agency, Cairo, that is providing support to refugee families from the African diaspora. So the way how they are able to provide these services is we gotta do blended and braiding funds approach, right? There is no way how we could be funding existing programs with the money that we get from the ELGO, even tapping into like foundations. There is always this need for us to go outside of the existing scope of work and seek funding. And that also takes a lot of resources and our time away from other types of work that we need to be doing.
Good point.
I think the only thing that I wanted to add is that this topic of navigators came up over and over again and was the number one thing that our hub board talked about, but they didn't call him a navigator or a case manager. They called him a super navigator. So it's the person that the case managers and the navigators on the ground, the home visitors, all the agencies had a way. This would be a person that would watch for the changing in the workforce. In our small community, we have the same 12 people that show up for the meeting, but they keep switching jobs. And so who keeps up with that? And it needs to be different in each one of the counties because the system in each county is very different. So that local person looks different. So thank you for asking this question. It's really important to my region that we address the need for navigators and the no wrong door aspect of them.
Okay, thanks, Kelly. We're going to go to George, then Kelly and Peter. So George, you're muted, George.
Kelly, thanks. This is a question for Kelly, but a little bit of follow-up for what you said. It felt like you were trying to get at that maybe that there needed to be an office, I'll just say in Pendleton or an office in Eastern Oregon somewhere that represented the state for faster decision-making or for more support that's direct on site. Is that what you were getting at?
I actually think it's even more local than that, in the sense that there's somebody locally that would connect with that state person that has that ability to provide those answers in real time. I think that having one state person isn't going to, they'll be too thin. It'll be too thin and spread out too thin. So I don't
I
think we need to have someone in each community. Yeah.
Okay, so a person from Delk in each community, or is that what you're getting at, to help support with everything?
You know, I think that the Delk would support. So our question number 2 is, you know, what's our hub role? And I think that what our hub sees themselves as that local navigating position. So right now we do the assessment, the community assessment, to see what's available. We listen to parents. The number one thing that we hear from parents and our child care providers is our challenging behaviors. And so they go to their pediatrician. The pediatrician doesn't know who to call, or the health department, or the home visitor. There's no one. We'd like to think that they could, you know, look up in 211, but we don't have anybody locally that's keeping 211 information up to date. So I actually think that the hub system that we have in place right now has an infrastructure. It just doesn't have the capacity to have that position in every one of our communities. And when I say community, over here on my side, it's probably county specific, not city specific or regional specific.
And
I don't think it's a Delk employee.
Well, I wind up feeling I mean, I'll just say my sense of the structure is someone from the state that can really help to get services, which to me would likely be somebody from Delk, but it might not be that. The other thought I had to expand on was the pyramid that you were getting at. Is that like you were thinking? The schools do multi-tiered systems of support, so RTI, and we do that for green zone, yellow zone, red zone for behavior, and then we have tier 1 teaching, tier 2 teaching, and tier 3. Is that what you're getting at?
So it's similar to that. But it's for early childhood. So the pyramid model for early childhood, you'll find more information at a website called challengingbehaviors.com, I think, challengingbehaviors.com. And you'll get a lot of information at the Early Childhood Technical Assistance Center. And I'd like to find out who the 40 people are that just went to Florida and participated in the National Training Institute on Effective Practices. I also have been so I'm learning about the pyramid model, but what I'm seeing is our Early Childhood Special Education LEAP program is seeing just remarkable results. We have people who are coming to visit the classroom and implementing the pyramid model or the LEAP model, which is similar. It's using the same pyramid model, but LEAP is for special education. They are coming and learning and trying to get more information. Right now, the original pyramid model states were California, Colorado, Hawaii, Iowa, Massachusetts, Maryland, North Carolina, Nebraska, Tennessee, Vermont, and Wisconsin. So it's not new, and it's not only in 1 or 2 states. It really is having an impact across our nation and doing some good work. So it's similar to what you see in the K-12 setting, but it's very specific to early childhood.
George, if I can just add, because I've had a chance to have some exposure to pyramid in some of my visits, and I also, working in K-12, familiar with zones of regulation and RTI, I would say they're very similar. I do think they are very much aligned and have similar approaches to child-centered support for social emotional behavior. So I think, and that's a good segue to my observation. There were so many nuggets here, so thank you all. The alignment piece is what sticks out to me. Like, the fact that, we don't have K-12 knowing the early childhood interventions and vice versa is a miss. And even though we all sit at this council table and the agency directors come, there's still, I heard alignment brought up in multiple ways. And I think that is something we can do something tangibly about. So I have a lot of interest in thinking about how do we do more to better align our systems to make it easier for both providers and for families, because I hear it coming up on both sides. I think there's opportunity, and it was brought up a lot, to do more in community. And I would agree, as as I've had a chance to travel, and I've shared this with Chair Miller, the more we are embedded in visiting communities, the better I think this council is serving the state of Oregon. And so I would just reinforce that to the degree individuals can get out, but we used to go, I've been on the council very long now, and there was a time where we did go into communities and got a chance to listen and connect. And there's just no substitute for that. And so since we are sort of post pandemic, so to speak, and I think it's safe to go, I think we should try and figure out a way to do so. The last observation that I had, and as I said, there's a lot. So yeah. I think I have a curiosity around the feedback loop, because I've heard that as well. And I'm wondering, what are the mechanisms to make it easier for that to exist? Because that's a recurring theme for years. And so that feels like, I don't have the solution to that one, but it feels important for us to figure. It feels like a fixable thing. So those are my thoughts.
Okay, thanks, Kelly. And I just want to take a second to welcome Dave Baden, who's the, OHA director. Thank you for joining us, and also Steph Jaram, whom we know well from RUIACT and partnering. And, I think this conversation about alignment and partnering, it's not just DELC. DELC isn't going to do it. And that's why the council is here, is because we have 6 agencies who are committed to this work. So I think as we talk about navigators and, how do we work together, it's really great to have one of our biggest partners, OHA, on the call. So Dave, thanks for making time to join us.
Good, thanks. Yeah, so much to learn and connect here for sure.
Thanks. Peter, you've been waiting patiently.
Thank you. Thanks, Sue. And thanks to all the hub directors. Great ideas, great discussion. I wanted to hit a couple points. Kelly, I really appreciate you talking about root causes and the need for us to make sure we're always looking at the root causes. I was recently introduced to a program that I had not heard of before called Trust-Based Relational Interventions, TBRI, out of Texas Christian University's Child Development Program. I think there's only 4 practitioners in the state of TBRI. One recently moved to Southern Oregon, so we're hoping to engage. But it's a way to work with traumatized children, a very clear, directed way to work with traumatized children that has a coaching component too. And I look forward to delving more into that. On the issue of navigators, I'm with everybody else. I hear this all the time, and we're working with this all the time. Our family relief relief nursery, the family nurturing center here in the Rogue Valley, they train parent peer support specialists. And the parent peer support specialists have proven to be really excellent navigators and great assistance to families. Southern Oregon Pediatrics has also gone as far as to hire 2 full-time employees whose job is to focus on helping new moms access resources in the community. And a third program is coming out, ODE. It's a pilot program. The Phoenix Talent School District is one of the districts that's engaged, where they have 3 full-time employees that are working to help families in the K-12 system connect with resources in the community. So I think this is kind of growing, and I think that we can do that to promote it and to increase the number of navigators in early childhood, in K-12, in healthcare. The more we do this, the better chance we'll have of starting to align systems, because we'll have people who know how the work across the systems are being done. Thanks, Sue.
Sue, you're still on mute.
Sue, is it okay if I just jump in? Are you? Because you're on mute and so I can't, you're on. Okay.
All right, yes.
So I just want to also thank the four of you. These reports are amazing and they're so rich. And the fact that you did that was really great. And it was, I hadn't realized when I read through it the first time that each of you was asked to focus on a different sector. And so I was looking for, oh, what's similar and what's different across all of these? And it sort of jumped out at me what was similar and different. I was sort of curious about how that happened, but now I understand that you were charged with looking at different sectors. I think that what Kelly is saying about basic needs and what Renee has reminded us about housing are, all of course linked. And the fact that these families are starting with so many fundamental challenges is something that we just have to wrap our heads around. So to me, I sort of saw basic needs in housing, and then the social, emotional, and trauma sort of dimensions of were really strong themes for me. And of course, I love the notion of navigators, super navigators, peer navigators, and so on. But we have to be honest with ourselves that part of the reason we need navigators is that that's a workaround to systems that are not aligned and systems that are dysfunctional. And that's where our job comes in, is how do we get the systems to be better aligned so that we don't have to backfill and have these workarounds with these super navigators. And so I think the thing that I'm thinking about is I'm wondering whether whether we should be thinking about, are there a couple of priority areas where we as a council want to make sure that we're pushing system alignment? And, whether it's something related to the basic needs part of it or something related to the social emotional learning part of it, those are two themes. But I wonder if we could, it's because it's so big. When we talk about systems, as Begona reminded us, it's really abstract, and it's really abstract to the families too. And so how do we carve out something that is doable and that makes it more concrete and that exemplifies the kind of wins we want to get? That's what's sort of rolling around in my mind. I don't have a solution, but that's the question I'm asking myself. And I just really appreciate the four of you for forcing the issue and forcing us to sort of attend to it all. Thank you very much.
Thanks, Anne. Great comments. Begonia, do you want to do a quick comment and then go to the second question?
Absolutely. So one thing that I don't want to leave out is parents also highlighted, and providers, the need of having qualified interpreters. Just because you are an interpreter and you speak a language doesn't mean that you speak the early learning language or the housing language, but we need to have cohorts. I'm not going to say by sector, by content, but definitely tailor what they're learning so that they can support. I'm not going to say globally all sectors, but support them better. And the other thing is about the social emotional learning. Access matters. And if you're an early childhood provider, you might not have a framework for like positive behavior intervention and support, but you might have a one standalone strategy like second steps. But evidence-based curriculum doesn't work for all the communities that we serve. Many of them do not stick around for too long. And many providers are only focusing on the child, but they do not focus on the staffing, the family, and the child.
Yeah. Excellent points, Begonia. Good reminder. So, Council, the second question that we've asked directors to respond to is, I guess, probably an obvious follow-up, which is, where do you see the hubs playing a role in the feedback that you've received? And I think, Kelly, you sort of summed part of this up by saying hubs have the infrastructure, but you don't have the capacity. So, and why don't we just go in inverse order this time and ask each hub director, so where do you see the hubs landing in this area? And really as a partner with the council, because we're in this together. So Kelly, do you want to lead off with that?
Sure. And I think I've already said some of this, so I'm going to repeat a little bit, but I'm really responding to what my hub board talked about. So the timing of this presentation, our regional system assessment, and the summary of our Raise Up Oregon listening, they all came together at our board meeting on Monday. So they had a lot to share. I don't see the core of the hub role changing. We're going to continue to respond to local concerns, and we're really going to have a sharper focus on the root causes, always asking when we hear about something, it is saying why. I like the way Anne went to saying, you know, wow, what would happen if we didn't need navigators, if we had a system that people could navigate? That's really going to a root cause and talking about them. I think the thing that I want to say that's really, I don't know if it's just ours, but what's really important to us, our capacity is dependent on the DELC's infrastructure. It's really important that the DELC has a strong, has a way of sharing expertise that we don't have in Eastern Oregon. We really are dependent on the DELC or on a state system for us to do our work. And I think that, you know, Raise Up Oregon, having the cross-sector leaders is what is going to make our job productive and efficient. So our role as hubs has to continue to be nimble. We have to be able to respond to our region's needs. I would say that as a result of our 2.0 engagement sessions, my board's really interested in learning more about the system navigation in a way that it really addressed the concerns of parents and community partners that we heard from. We have this engagement process gave us some really clear direction. But the board was really clear, they had a whole conversation about this, is that we don't want to expand something that's not working well. So we don't want to expand, a lot of people in the listening sessions said they didn't understand what scale up meant. And I think it's because there's a hesitation or a lack of trust that the state's going to expand something or scale something up that isn't working already. So don't scale up what doesn't work. Please help us develop something that works locally and then expand it, then scale it up. So all that being said, hubs can develop the role of a super navigator, I think. I think that we can determine the scope of work and the cost to implement, but it's going to look different in every community. So, and I want to say a super navigator is not that case manager. The super navigator is the one that connects all the programs to the families. So the super navigator works directly with the programs. So a family going to any program or service in the community has access to those programs. As my hub board learns and goes through the region-wide implementation of the pyramid model, and I'm not an expert, I'm going to learn right along with them, we're going to address the challenging behaviors that we heard over and over and over by creating a system and policies that promote the positive social and emotional development, and by using trauma responsive practices. So, and again, I want to say that some of the early learning hubs are already doing this and doing it really well. We would like to see the council support this more through the statewide level partners that are on the Raise Up Oregon plan. Okay. I think I'm going to stop talking. Yeah.
Thank you, Kelly. Great comments. Sorry, Dorothy. I should
comment real quick to
Yeah.
Kelly's comment. Respectfully, Kelly, I do think you made the comment that you don't have the expertise. I actually think that the hubs do have a lot of expertise. And what I observe is that there is expertise both in what the community needs and solutions that have been vetted by community. So I actually think there needs to be more of a two-way street between hubs and the state. Because yes, there are things that DELC can provide, but there are also things that these communities can provide to DELC that could help inform the entire system. So I would just challenge the idea that all the expertise lies in DELC. And I have definitely observed otherwise, that there's a lot we could be learning from other communities.
Thank you, Kelly. I have to agree with you. And I think sometimes because we don't have, you know, the degrees or the universities in our community, sometimes we think we don't, but you're right. two-way street. Thank you.
Thanks, Kelly. Good point. Dorothy.
Thank you. So just building off of Kelly's comments, a couple of points I wanted to make around the hub role and capacity is, I think when we talk about alignment, there is a role locally for early learning hubs to address what alignment we can across sectors at our local community levels. So understanding what the root causes and conditions are that will that will like create local solutions, but then also elevate when there's a barrier to that alignment, because that's something that needs to be solved at a state level. And this is a hub role we've continued to have, but like we need to be able to have that system, that feedback loop to the council, particularly to the council, because not just DELC, because these are barriers across sectors. And I think at times as a hub, we don't always know where to place those barriers or the right process to illuminate those barriers that we're experiencing that need to be dealt with across sector, across agency at the statewide level. We can certainly share those with DELC, but it isn't all DELC's responsibility. It is across multiple agencies. So I think that that's a role that we need to continue to have. I also think that, in terms of the hub's role in understanding local capacity and conditions, Raise Up Oregon, the strategies that are going to be in this next edition can't be implemented equally across the state, right? Every community looks different. So as an early learning hub, I do think, I think about our regional system assessment work and being able to figure out what parts of Raise Up Oregon is our communities the conditions already in place to move those strategies. Like, what are the strategies in Raise Up Oregon we can move forward because those conditions exist to move them forward, and where do we need to build more capacity to move other strategies forward, if that makes sense. So for example, like in some places, co-location of housing and childcare may already be happening, but that might not be happening in my community because we don't have the right capacity and conditions yet. So how do I build those? I think that's a really important role for the hubs to have in understanding that. And then I do think when I think about the feedback loop, your curiosity, Kali, around like the feedback loop, I think that there's this place for hubs to continue to be a space to give feedback to the council. And what does that structure look like so that you all know like what is coming up in barriers for families, what progress we are able to make, are families experiencing that progress? I sometimes wonder of like, oh, we did X, but does a family on the ground actually feel like we've made progress? I think that there can be a disconnect between what we say we've done and what families are experiencing. And so continuing to root both like what the data says and what we can click off as, yes, we did X, and what families are feeling. I think building that connection is a place for hubs to be in. And the last thing I would just say about capacity, and I think you summed this up, is hubs have the infrastructure, but not the capacity. And I'll just use the regional system assessment work as an example. It is such exciting work, but my personal experience with regional system assessment is I struggled to find my own capacity and my team's capacity to do the regional system assessment work in the most meaningful way to get the most meaningful results for my community. Even with support of consultants that DELC provided, I often found myself every single month going, do I do the regional system assessment work I need to do in between meetings, or do I do this other piece of work? And I was making those decisions on a regular basis. And both things were important. The localized solutions I was working on, as well as the regional system assessment work. So we just don't have enough of us to do all of the work that we need to do.
Okay, thank you, Dorothy. Not surprised to hear that. Begonia, where do you see your hub fitting in here?
Yeah, definitely. It's scary to go after Dorothy and Kelly, and I don't think that I can be that on what they're saying, but I think that I can find at least one thing. Definitely, yes, Raise Up Oregon is going to drive our own collective impact based on our unique strengths and challenges in our regional communities. But one of the things in terms of capacities that we could do on the top of what Dorothy and Kelly described is involve like governance body to align funds in those areas of Raise Up Oregon that we feel our community sees as crucial, working with partners to determine where the alignment exists within their own scope of work. And let me use an example. So we just started having discussions about how we're going to be addressing suspension and expulsion. We actually listened to the model that one of the local agencies, Adelante Mujeres, has. And we are looking at ways of like, well, can we learn from what Adelante is doing and is doing right and is working really well? And can we embrace this thing in other programs like school districts and other agencies? So these are like good models that if they already exist and they are working well, so let's not reinvent the wheel again.
Yeah, good point, Begonia. And Renee, where are you on my screen?
Yes, I have even a greater challenge than Begonia, as you know, the fourth in the relay, right? Yeah, Raise Up Oregon, when it came out in 2019, was a game changer for the early learning hubs. And it was finally a document where every key sector partner could clearly see themselves in the early learning system. And so we have used it very intentionally in identifying what local strategies we can, what local strategies we already are doing, and then what else we can and should be doing to support those objectives within Raise Up Oregon. So that has been wonderful. The challenge is that we really have a coalition of the willing. Although it's in our contract to apply Raise Up Oregon and to use it as a tool. For other partners, it's not. And so they are voluntarily coming to our table. And so something that would be really helpful is if the state agency leads would really have those conversations within their agency to encourage and increase collaboration. Having said all that, we have fantastic partners in Southern Oregon with a tremendous amount of collaboration, but I think we have an opportunity to do even more. So that's one thought. And then going back to Kali's comment about where the expertise lies, I agree that it really is locally, and I would say the expertise lies with our families and with our organizations who are serving families. They know what is needed. They know where the gaps are. They have suggestions. And so the hubs and hub partners coming together have the opportunity to align systems to make those needs a reality. And to whoever it was, Dorothy, I think, talking about the scarcity of resources. You know, hub funding, every biennium goes down, but hub collaborations and the work that we're doing goes up every biennium. And so although funding is fantastic, it really, the magic happens with the relationships and the collaborations that can withstand a 15% budget cut. So that's really where the magic happens. And then my final comment would be to agree with whichever of my colleagues said that we really do rely on DELC, who has the authority and the decision-making power to support those who are bringing the expertise and the needs forward. And oftentimes it's critical to move quickly. And we know that state systems often don't move quickly. So that would be another request into this new Raise Up Oregon, is figuring out where we can be more nimble and more responsive and continue to let our stakeholders, our families, and our partners know what is being done, which will encourage them to continue to come to the table to give us their valuable time and their feedback, because we frankly can't do this work without them. So those are my 2 cents.
Wow, you guys are amazing. We knew this would be just a dynamic conversation. And council, we have about 9 minutes left with these amazing presenters. I'm going to go to Katie, and then if others want to make comments. Katie, welcome.
Thanks. I think I finally have my internet stabilized.
All right.
I've really been getting a lot out of this conversation, and I want to echo something that Kali brought up as I really view the hubs in a lot of ways, but as a feedback loop, as we do raise up to, as we implement some of the new funding strategies or allocations that we have in the next biennium. My interest in the input that I've gotten when I've talked with folks in my region is how well is it working? How easy is it to navigate? And I love this idea that we've all talked about super navigators and whatnot, but at the end of the day, the process just has to be easy. And otherwise you're sticking a Band-Aid on stuff over time. And I think that hubs have a big role to play in the feedback loop of, hey, this didn't work. Here's a process that didn't meet the needs of the family because of XYZ. I think is a really healthy feedback and a great way to improve this system. And it just an observation that I get reminded that we're still just, even after all the wins that we've had with funding and then putting up a new department, there's still a scarcity out there. There's scarcity of childcare and health human services for families, but also in the hubs themselves. And it's a little depressing, but just wanted to acknowledge how hard the work is, how dedicated you folks are, and how grateful we are.
Yeah. Thanks, Katie. We are very grateful. Dave.
Yeah, thanks, Sue. Thanks for info and chat today. Lots of good love heading your way. The piece sort of resonated in my mind of connection points. And, I'm just thinking, we got state received the okay for in our recent sort of Medicaid work to, to have continuous eligibility for kids up to age 6. Once they show up on Medicaid, they're on Medicaid, right? And so, just how that opens opportunities between the early learning hubs, CCOs. I think I've heard some connections from CCOs in the past, and y'all probably have some of those, but just, I think the ability to focus maybe more on maybe where there's someone of, well, are you on Medicaid, or some of the eligibility sort of things that may come up in some of those discussions. Hopefully it's then more of ways for referrals into different networks. And again, I think again, to the assuring that this is as easy as possible, to sort of Katie's last comment, I just think that there's some connectivity of ease to really focused on the need of the child and how sort of those things can be linked. But that was just sort of what was resonating of sort of that connection point. Thanks, Sue.
Yeah, thank you, Dave. We know that, healthcare is just such a core piece for families. And it seems to be a place where there's still credibility. People actually believe usually what their doctors say and stuff. And there aren't many credible messengers anymore. So no offense to all of us on this call.
No one ever listened to me anyway during the pandemic. So, no, we keep trying.
So I appreciate your comment, and certainly that Medicaid waiver is game changing, and we need to find out a way that we and our hubs can work to really take advantage of that in a positive way. So we'll go to Subin, and then Peg, Kali, Begonia, and we've got 5 minutes left.
I just wanted to make a comment that around the discussion we've been having around navigation and the alignment, and I feel like we've been juxtaposing those two ideas. And one of the things that I just wanted to say is, yes, I absolutely agree. There's plenty of work to do in terms of systems alignment, but I think that navigators or liaisons, engagement specialists are doing more than just being a Band-Aid to alignment issues. I think a lot of times folks in those types of positions are working with families in relational ways that, for example, there were some comments in the findings around decolonizing some of the spaces and systems and some of the kind of the attitudes that people might have or dispositions people might have towards the system. And that's something else that engagement folks do, right? And so I just want to make sure that we're like, in some way, I think there's beauty in the idea of a navigator and these liaisons, the relationship-based folks who are doing that work. And every time I get a chance to talk to them, I'm hearing about how important it is.
Okay, thanks, Suben. Peg?
This was a great presentation. Thanks a lot. It's like Subin and I had talked ahead of time, because that's exactly what I was going to say. I think a lot of this is about trust and relationships, and we can offer all the services we want, but if we don't make it, number one, easy, and number two, that families aren't trusting of the services or confidentiality or whatever that we're offering them, they're not going to avail themselves of those services. I don't know, Sue, whether medical people are really trusted. I think that's still out for debate. But
okay.
but
you know that better than I.
But I think we have to earn it. And and again, in medicine, we talk about that people think that medical people are talking to each other, so we better do it. And I think it's the same with early education, that we need to be sure that we're listening to people, but also talking to people as well. The other theme that really came up for me, and we've been talking about it with regard to home visiting, number one, the relational thing. Number two, that we need local expertise, but support from the state. So people know what works in their communities, and the smaller communities, I think that is particularly true, and trust is really important. And sometimes trust of outsiders is not as close. So we need to build on that. But thanks. I really have appreciated the presentation.
Okay. Thank you, Peg. Kelly.
Yeah, I think Dave's comments, I just wanted to illuminate. I mean, I think his comments also illuminate another sort of disconnect in alignment, because the Medicaid eligibility is wonderful. And yet we've heard a lot about social emotional needs of children, and there's not a strategy in behavioral health within OHA that is focused on young children. And that disconnect, I think, is the exact alignment that is missing that could help families and children and communities support kids. And so how do, and I would say, to you, Dave, like, how does OHA not only focus on eligibility, but on behavioral health? Like, we focused on home visiting here often. This is a whole nother part of healthcare that keeps coming up. The behaviors keep coming up in early childhood. And I think it requires strong alignment between early childhood and health systems to address. And we have CCOs and hubs, both in communities. How are they working together to address this issue? So I would just highlight that.
So this is Begonia, and this is what we hear really clearly. Families want us to expand health services around mental and behavioral health and dental care. That raised number one on the list. But they also say you gotta streamline the referral process. We need those navigators, but we need the interpreters to help us, right? But we also want you to reduce the waiting time, and we need to build that trust with the medical people. And many times our insurance is not taken. So this is what they share with us, and all points were well taken, but they are difficult, all of them.
Yeah, good point, Begonia. We need to stop and move on to our next panel. On behalf of the council, I want to thank Dorothy, Kelly, Begonia, and Renee again. Fabulous presentations, great outreach work, very informative. We're going to have a lot of work to figure out how to incorporate many of the suggestions that you all are bringing to us, which really originate from families and your communities. So we're indebted to you, and please stay connected to all of us. And just so you know, we are planning right now, the hope is that we will be traveling for our October retreat and getting out of the valley. And I've leaned on Katie Brooks to hopefully welcome us to Central Oregon in October. So we've gotten that message, and we're really sorry that for many reasons we haven't been able to do that earlier, but we'll be on the road. So thank you all. And at this point, I'm going to turn this mic over to David Mandel, who's going to introduce our new panel and also facilitate the conversation. So thank you to Colleen, Beth, and Jeff for joining us. And David, it's all yours.
Thank you, Sue. And I have to say, this is really just a great honor and pleasure to have the chance to facilitate this conversation today. We really have three fabulous Oregon researchers with us. Beth Green, Director, Early Childhood and Family Support Research, Portland State University. Colleen Rulin, Director of Oregon Pediatric Improvement Partnership. And Jeff Todal, Director of Research, Center for the Prevention of Abuse and Neglect, University of Oregon. While we tried to sort of set up this panel to have sort of a diversity of perspectives on early learning and care, health, family preservation, also can't help but point out just the great similarities. I think, but on this panel, each of them brings just a wealth of Oregon-based research experience. I think we could easily fill an hour of rich conversation with any one of them. All of them also just have a real deep commitment to the intersection of research to practice. These are not folks who are sitting in their office. These are folks who are really deeply engaged in communities. And I think all of them have demonstrated just a commitment to working closely and listening authentically to families, children, and practitioners. So given all of that, I think the task before us is really challenging today. So what we've asked them to do is to step back from any of their specific research projects and to reflect on what they've learned, what they've seen, what they've heard, that they should really, that they think should really, that you as a council should know as you are working on this second edition of Raise Up Oregon. So the structure of the panel is going to be fairly similar to last panel. I have a couple of questions that I'll ask of each of the panelists. They'll have 4 minutes. We'll have a little bit of chance for conversation with the council, and we have I have a couple follow-up conversations, and then again, hopefully some time for more conversation. Because I want to really hear from them, I will move quickly to the questions. So looking at Raise Up Oregon and speaking from your perspective as a researcher, what do you see as strengths in terms of Oregon's draft plan? I'll start with Beth and give Jeff, and then Colleen, and again, we're giving each of the panelists 4 minutes for these questions.
Okay, thank you, David. I'm Beth Green, and it's a pleasure to be here today to share my perspectives as a researcher. But before I start, I just want to say that I want to be clear that although I am a researcher, that doesn't imply that I don't bring my own values, perspectives, and biases to the work that I do or to my comments today. I'm a white, upper class, and highly educated woman. I work for an institution. I am not an expert in what families need. That would be up to the families themselves. So I just think sometimes when people hear the word research, they think, oh, what she's saying is the objective truth somehow, and it should be taken as that especially important. I just want to caution you that that is not the case. I have done some research that I hope has given some families an opportunity to share their experiences and their voices. I'm going to refer to those families as marginalized families. And what I mean by that is families who've been shut out of power and decision-making because of systemic and structural racism, classism, sexism, ableism. I think providing some opportunities to bring their experiences here to you as systems leaders, but there's a lot of work left to be done to really
engage them as authentic partners in leadership and decision-making at the state level. Okay, so that's enough said. I don't want to take up my time. I'm going to try to be brief. David asked me to speak to the strengths that I saw in Raise Up Oregon 2.0. And the first thing I noticed was very glad to see some of the new language around the goals. I think people they'll be much more able to get behind some of the goals around wanting children to thrive as opposed to being ready for school. I think it's great to see the broader statement around wanting families to be supported rather than stable. Not even sure what that means. And I was really happy to see that the word equity shows up repeatedly, and that one of the goals is to make sure we have an equitable system to support our families and children. I do believe that words are important, and so I think there's some comments throughout that I'll make about language as I move forward. The second thing that I saw, which was a strength, was I was really happy to see some of the very specific structural changes that were part of the objectives and strategies, especially within Goal 1, which speaks to systems alignment specifically, but also embedded throughout. I was part of some of those earlier conversations today, and I think that real need to intentionally create structural changes in the way that the systems and agencies work together is so important. And I was glad to see some of those: co-location, navigation, shared eligibility systems. Those are the things we hear from families that they really, really need. They experience every day the disconnects, right? They live those disconnects in ways that is up to systems leaders often to change. I was also pleased to see the role of the hubs elevated in terms of supporting cross-sector systems change. But I do worry about the lack of authority from various system partners other than DELC in terms of their leadership at the local level. And I heard one of the hub directors speak to this, but I think there could be more clear direction from our other state agencies other than DELC in terms of really giving them the authority and the capacity they need to bring the partners together more effectively.
And Beth, I just want to give you about a 40-second.
Okay, well, that's good. I've only got one more thing to say, which is the other strength I saw was I was really pleased to see explicit naming and honoring of Oregon's tribal partners and their sovereign governments, and would love to see more partnerships intentionally embedded with the tribal partners through the other goals and objectives. So thank you.
That me, David?
Yes, I should take myself off mute.
Okay. Hi, everyone. And to echo Beth, I really appreciate being here and the opportunity to be in this conversation with all of you. And I came in about 7 minutes before 11, and it sounded like what I imagined. There's a lot to like, I think, for me in this document, and a lot of sweat, and a lot of hard work is so obvious. So, and before I go further, I want to say that I'm working in my comments to represent what I think is probably about 125,000 Oregonians that I've connected with, and others that I work with have connected with directly over about the last 25 years. And many of those conversations were around trauma, violence, trauma healing. It includes rural and urban and frontier Oregonians, youth, the youth of Juventud Faceta, the youth of 15th Night, adults and youth who've been incarcerated, and many others, including folks who are from traditionally excluded groups. And so most of that work has largely been about listening. And so I'm going to try to do my best to reflect those perspectives. And so, what about Raise Up Oregon? We're asking right now to give some reflections on strengths. And I think there are many. It's super thoughtful. And so if I could just reflect on a few strengths that I think have kind of high probability to support success. So they're correlated with likely success. And so one of them is that, and you all have a very good sense of this, that Raise Up Oregon it's systemic. So it's a systemic response to a systemic problem. And so, as no small thing, that there's been a lot of intentionality around matching the response to the problem. It seems to me to be visionary, with practical action taking, and ambitious with specific on the ground deliverables. And as Beth said, clearly it's center and equity, that language is all throughout. The thing I want to highlight for me and for those that I've mentioned and spent a lot of time listening to is that it seems like Raise Up Oregon is defining lived expertise as expertise. And so I'm making an assumption that words and deeds match on this one, that traditionally excluded groups, youth, parents, caregivers are directly involved in shaping this and its continuous improvement, and that they, in fact, have substantive decision-making power. If that's true, if that's in this, highly increases the likelihood of success and sustainability. Strength-based. That language isn't innocent. Beth mentioned this too. I noticed that the term parenting, I like that for me versus parenting education, because it suggests that all of us can benefit from parenting versus those who need education. It's cross-sector with vital agencies, and it seems to be an effort to engage public and private partnerships and investments. That, I think, helps for sustainability. And then it seems like it's very much aligned with promising national trends. The U.S. Children's Bureau is working to emphasize family support and outreach over and above surveillance. It seems to be aligned with strengthening families' protective factors. And as I understand it, we're working in Oregon and with Raise Up Oregon with the BUILD initiative for technical support. So those and many other things that come in alignment, I think increases the likelihood for success. And then the final thing I'll say right now is I think really about entry points. It seemed like there's been a lot of thought and intentionality around sort of the natural doors, the natural points of connections where kids and families are in our communities. So for example, pediatricians' offices and screening as an opportunity source. It seems to me there's a lot of that. So if there's lots of opportunity and the attitudes match the opportunity, then I think it increases the likelihood of in community making a difference.
Thank you. And you landed perfectly on time. I will now hand it over to Colleen.
Hi there. Thank you so much for allowing me to be here. I just want to set the stage of the strengths I'm going to note. Our organization does family-centered implementation of collective impact work that's focused on improving the quality of healthcare that young children receive, which therefore has to include an improved coordination across physical, behavioral, and oral, but it needs to improve closed loop connection to early learning services and supports that exist outside healthcare. So the first strength of this plan is that the plan actually exists and that you're thoughtfully creating it and updating it. I cannot tell you, as an organization that works on the ground level to try to implement efforts to ensure that children actually experience the bridge of connected and available services from healthcare to early care, public health, housing, and other human services, it's critical that there be this synergy and collaboration at the state level and with state level priorities. We can't keep asking local partners to work together to address gaps, share data at the local level, if it's not also mirrored at the state level. So I just am deeply appreciative. In terms of specific strategies that address gaps we've seen in our applied work in Oregon, I'm just jumping up and down around strategy 13.1, which is to broaden the EI eligibility criteria. It is critical. Within healthcare, Oregon is one of the top states in the entire country in implementing EPSTD aligned developmental screening in primary care. And yet we have one of the most restrictive early interventions in the country. So what we found is that a majority of children who are identified in primary care, a top referring entity to early intervention, do not receive follow-up services in early intervention. Children who have just social emotional delays do not meet our state's EI eligibility criteria. So all the wonderful and enhanced supports that are providing to EI eligible children are for children who are eligible because of other domains. So I'm just elated about that strategy. All of the strategies in objective 1, I would like put an exclamation mark around. You nailed it. I thought you did a great job. And I strongly support objective 9. I will just say specific to strategy 1.9, establishing data use agreements and sharing data across state agencies. Collective impact work requires collective impact data that is derived from agencies in different settings, but it needs to be at the child level. This has been the power of the child health complexity data that you saw in your pre-reading packet that now is tragically slated to end unless funded in this legislative session. As Anne knows, the powerful and transformative work highlighted in the pre-reading materials was directly galvanized by having cross-sector galvanizing data, the health complexity data. So I would just encourage within 1.9 that you examine the data use agreements we already have and have had that are now set to go away, and think about expanding their use. I'd also encourage that you share that data not just at the state level, but at the community level so that it can guide and inform efforts like the child health complexity data has.
Thank you so much. Now I'm going to both flip around the question and the order. So heard a little bit of some of the strengths, but now I'd like to hear from each of you on what do you see as important gaps in the plan, and what would you suggest to address those gaps? And this time, let's go Jeff, Colleen, Beth.
All right, sounds good. So, I think I'll take this and really highlight a couple of things: implementation, and then primary prevention. And I don't know that these are gaps, actually. This is more about questions that I have and some observations. So they may or may not reflect gaps. You all would have a better sense of that than I do. So just uphold that. So, and you know very well that this is complex. And this is, more complex than moving a person's rocket from the face of this planet to the face of Mars. I mean, it's a lot. It's complicated. And so what I'm wondering about is logistics and implementation support. So I don't think the devil's in the details on this. The details are useful. The devil is in implementation logistics. And so, high quality implementation support is vital to success and sustainability. So, and there is a tendency to underinvest in implementation. And I don't know that that's happening, but I wonder about it. And efforts like this are, typically most stressed at the local level. And it's not about local capacity. We have lots of talent throughout Oregon communities. It's about proper investment in implementation systems of support. And implementation science, in partnership with community and persons with lived experience and expertise, has a lot to offer here. So just very quickly, one local example. I'll just hit a few highlights. This is led by the Ford Family Foundation. You may know a lot about this, something called Protect Our Children. The outcomes with Protect Our Children, some 40,000 Oregonians trained around how do we work together to prevent child sexual abuse. The outcomes are compelling. Most Oregonians would I think, be inspired. Give a couple, 5 times more likely to know that what to do to prevent child abuse, those who participated. Hopefulness about prevention increased significantly. At least 66,000 new child protection actions were taken by participants in a 12-month period. So, I mean, it's pretty impressive. And it's a bit about the curriculum, but I would say it was especially about the Ford Family Foundation's choice to invest thoughtfully in proportionate implementation support. So they built a co-learning culture, they built a relational culture, and that's, I think, been vital to its success. And so we have that as a model, and it could be scaled. And then the other piece I'd like to highlight is primary prevention. That the work of Raise Up Oregon is about primary prevention. So much of it is about creating protective factors, reducing risk factors. It is, in my view, primary prevention. But I don't see, though, how, and this is the question I have, how it directly shifts the culture of silence that harms so many of children and youth. So, for example, in one Oregon county, Lane County, 24,000 youth told us that they've been sexually assaulted. That's extrapolated from some surveys we've done. And then, so that's a lot of kids in one Oregon county. And then among youth who said they mostly received D's and F's, a full 82% shared that they observed things being broken and thrown in their homes due to an argument. And much of this trauma, is before the age of 6. And 47%, nearly half of Lane County youth had not shared this with anyone at any time when we asked them as juniors and seniors in our local high schools. So primary prevention can be embedded in Raise Up Oregon. It's actually best embedded. It doesn't have to be an add-on. So for example, Raise Up Oregon calls for screening. We could add to screening universal education and information sharing. So there are many opportunities here, and my hope is that it gets embedded. And so my final comment is that Raise Up Oregon, in my view, is much more likely to be successful if it embeds truth-telling, turning toward, hearing and healing from contemporary and historical harm, and restorative practices.
Thank you. Colleen?
Sure. The biggest and most alarming gap I see is in an explicit, direct, and targeted set of strategies that address the gaps we actually know. And they're why we developed the CCO system level social emotional metric. And we actually know even more now from the first year of implementation. We are in a crisis in terms of a behavioral health workforce that can address the issues we are identifying in young children now, and that predict their ability to thrive in school and their health. When children are identified by public health, early learning, preschool settings, primary care, there is not a sufficient provider network to serve them. As you saw in the materials, and thanks to the system level measure, only 3% of publicly insured children are receiving a range of therapy services that address issues identified. And yet we know that there are 12 to 17% of children who have a diagnosis that would benefit from those therapy services. And to the point just made, we know that there are 20 to 30% of children who, just looking at the health complexity data, which underrepresents, have adverse childhood experiences that, to the point just made, would benefit from evidence-based therapy services that address that and build their health and resilience. I really want to put this in a specific term because I don't use that term crisis lightly. When we look at the system level data, of the 30% of publicly insured children who we know have 3 or more experiences aligned with adverse childhood events, 9 out of 10 of them did not receive any CCO covered emotional support. Let me just be even more specific because I see it in some places. One of those factors is that one or both parent has been incarcerated for a year or more during that child's lifetime. So these are kids under 5. When we look at those 23,000 children who are publicly insured, who have a parent who has been incarcerated for a year or more, only 6.7% have received a CCO covered behavioral health service. There are not enough behavioral health providers who are contracted with CCOs and with private health plans to meet the needs we are identifying now. So I love your other expanded strategies around implementing home visiting, preschool, expanded EI, more screening, but I don't see the corollary of strategies to address how we address that need. I see a lot around consultation and building first-line promotion and defense, but I really think we need to focus also on the kids that we're seeing now and on the gaps that we see now. So my recommendations are add targeted and very specific strategies that are around behavioral health services within healthcare that address the needs of young children and families. And I would add them within your healthcare strategy, and I would add them within your social emotional supports, because that connectivity that we heard, I walked in the meeting late, but they were talking about, it's not just services, it's connection. I agree. I do have to say though, a navigator can't navigate to nothing. And so we need to make sure we build that up. Furthermore, I was rereading the 2021 progress report, and it was really fun, David, you were part of it, to see that there really was this across agency collaboration and support when we developed the system level social emotional metric. We still need this cross-system collaboration to do the actual harder work, which is implementing the metric, and not the metric, but implementing the services that the metric is capturing. So there still is this need for cross-agency collaboration and coordination, frankly, now more than ever. And there is a need for deeper and more meaningful supports, not just to CCOs, but to their required community partners that need to be part of this collective impact effort so that we can achieve the vision that was intended by that metric. So I think it's a gap and an opportunity that thankfully we have a really important lever to maximize.
Thank you. Beth?
Thank you. All right, I'll try to fill in with some of the things that haven't been said already. And I think my comments speak more to places where I saw perhaps missed opportunities in the plan for ways that it could take on a little bit more of what I see as transformative systems change and really shifting from fixing or helping families to really allowing families to be equal partners in the system. And I think the first thing I wanted to say was that it was noticeably missing to me that there was no statement of really core values. Like, what are the values that are grounding this work? There's some statements of principle, but there are sort of an odd combination of strategy and vague statements of things about things like being family-centered, committed to quality, value for partnership. And I think those things really need to be operationalized and they need to be defined clearly. And one thing that I really noticed was that there's no value for anything or any work that would advance an anti-racist system at the state or regional level. And I think that's a huge gap. I think if we don't name racism and how it's baked into our systems and structures, we're going to miss the opportunity. If you don't name it and call it out and take it on, it's not going to happen. We use the word equity as coded language, and sometimes that refers to race, and there's lots of other intersectional lenses that can and should be brought to this issue of marginalization from power, but I think that's a huge gap to me. Related to that, related to the need to really achieve what the plan refers to as equity. Equity is throughout, it's everywhere. It's not defined. What do we mean by equity? What do we mean by equitable access? What do we mean by culturally responsive services? There's no place where I saw authentic family leadership at the local level, or I mean at the state level. I saw hubs as sort of these middle people, like they, as we saw earlier, they listen to the families in their region and then they bring those voices to the state. That is not the same as shifting power authentically at the state level to families. And I think there's a huge missed opportunity here to bring family leadership, family leaders directly into policy and decision-making. We need to shift power for decision-making to the families. That's what's going to sustain our system and actually help really develop the system that families really need. So that's one recommendation that I have, is to create an intentional strategy for state level family leadership. We have some at some agencies, but not for DELC that I have seen. I would also say, and this is sort of related to what we were talking about before, this issue of equitable access. Again, it appears a number of times, but I still, when I read the Raise Up Oregon, it seemed like there was a lot of continued structural work that is going to maintain silos instead of really intentionally investing in this idea of equitable access. Now, again, that was not defined, but for me, what that means is that the system is really intentionally working hardest and directing the most energy and resources to those families who are furthest from power and resources. So these are the silenced families that Jeff was talking about. These are no doubt the children who fall through the cracks that Colleen's work speaks to. And that we need to acknowledge that there is a strategy in collective impact and other collective work that speaks to this notion of targeted universalism, that by paying attention to those in the margins and really intentionally prioritizing our work to support those families and bring their voices into our decision-making, that we will transform the system for better for everyone. Raise Up Oregon actually had some language around targeted investments in addressing disparities, and I didn't see that. It kind of fell out of Raise Up Oregon 2.0. I would love to see some more strategies embedded that really intentionally address disparities in outcomes that we're trying to mitigate.
And I think
Yes.
Beth, I think I need to open it up. So I do have a couple follow-up questions, but I think we wanted to have just a pause in about 10 minutes to give council members an opportunity to ask any follow-ups or comments on this portion of the discussion.
Well, I'll jump in just because no one else has. Thanks to each of you. Provocative comments. Appreciate it very much. The workforce issue, huge. Yeah, maybe I just follow up a little bit. Colleen, do you have any ideas for us to do? What can we do that we're not already doing in terms of the behavioral health workforce?
Yeah. I think it's going to need creative, locally driven solutions. But we have to change our incentive structure because it is yielding exactly what we have right now. If you look at some of the priorities around behavioral health workforce that are stated, do you see young children listed? We're thinking of like, we're in a fire hose, fair, but we're investing in adults that are highly costly. And so that is a downstream solution that's addressing the downstream problem that we have, but we have a hydraulic issue. If you get a global budget, why would you invest in children that aren't going to hit your global budget? So we just have a hydraulic issue, and I'm hoping that the metric can push on it. But to your point, Peter, this is not just a CCO problem, right? Like they're not going to be independently responsible, but we do not have cross-sector collaboration work happening as that CCO addresses the problem. And we have a hydraulic of payment issue. And so I think it's going to take something like this cross-sector work to think through what are people that could be in network that aren't? How do we prioritize the financing systems to invest, to ensure investments around making sure that we build that workforce? Because we currently have a system perfectly designed to perfectly focus the behavioral health workforce crisis on expensive adults. I would say a lot of those expensive adults have young children, and we're just not connecting that dyad. I think actually the data is quite clear on that. So from my angle, in terms of that's actually the missed opportunity that we have right now with the system level metric, is that I don't think the true authentic collective impact work is happening at the community level to create these really complex solutions. And part of that is supports connections, but it's also why I'm saying I think it needs to be called out here, because I think some of that is making some hard decision, and some of that is every system is perfectly designed for what it has. And so we have to think through why we are there. And a part of that is the financing and hydraulics. And a part of that is just how do we build a workforce and leverage a workforce that we have that maybe isn't in that sector, but could be.
Thank you.
Katie?
So I'm the layperson here. I raised 2 kids and that's it. That's my experience. But so I represent, I run a chamber for those of you who don't know me. And we have been involved in childcare for a long time. But when I hear you guys, my guts, I'm trying to get it to untie itself right now based on what I just heard. So my question is specifically then, help me understand what it would actually look like on the ground. What are some methodologies we should be thinking of that are practical, that are implementable, that you can watch the metrics over time? Is it just we need more mental health folks out there and with a direct connection with DELC? Is it a collaboration across offices on casework? Is it education? What exactly, where would you start? And Colleen, you can answer it, and anybody who just spoke.
You mind, Colleen, if I just have a quick reflection?
No, please
Yeah.
go first.
And this is, I don't mean this to be a sidestep, but if I could just reflect a bit on this, is that right around the University of Oregon, if you look at it over the arc of many years, the highest concentration of behavioral specialists exist. And this is not an anti-behavioral specialist comment at all. I think it's important. We need that. And Balmer just invested $500 million for behavioral specialists. And right around where the university sets in Lane County, the rates of harm for kids and families feeling isolated and distrusting systems is as high there, I think, as it is, it may be higher. And so it doesn't get us there. It's part of it. But if we invest in the best behavioral health system imaginable, in my view, in 30 years, we'll have very much the same problem. It's where we put the investment. And it's not an anti-behavioral intervention system at all, but I just want to offer that reflection.
I'm going to push back a little bit because I think it's partially the words. When I say behavioral health, I think you think of one scope. And what I'm saying is we are in a really interesting state that is pushing on integrated behavioral health, is thinking about how could community-based providers provide billable behavioral health services. I agree with you. We will not get there for birth to 5 with PCIT, CPP, our traditional models. We need to think and listen to families of what kinds of models they'll explore, but you can't have a system, have money go out to meet the needs of behavioral health and not build that system. So I am saying, let's reconsider what the system is that we're billing, that money is going out. I pay my premium and my employer pays my premium for physical and behavioral health. I can't get my kids' services. Balmer Institute is investing a ton. It's grade school age. And so I think this is the opportunity. This is what I mean by, like, we need to think creatively and not use the old ways of thinking. And Katie, to your Central Oregon example, this is where it's all the above. We worked with the Early Learning Hub to convene the collective impact partners. They used the data to prioritize how we would look at services. There were no specialty behavioral health providers in Jefferson County, and yet 48% of children publicly insured in Jefferson County have parental incarceration, parental substance use, parental mental health. What that's going to take is, how do you co-locate child level services with where adult services are, and how do you create incentives for them to think about that kid too? As you're thinking about housing supports for young children, how do you co-locate behavioral health so that they don't have to go? As you're thinking about that kid in Crook County, they're never going to drive to Bend to get their services. So how do we think creatively about payment supports for home visiting? So I guess the hard answer for you is, like, it's all, and that's partially why, from raising it up in a Raise Up Oregon strategy, I'm saying this actually is going to take cross-sector collaboration, because if we just put it on one sector, it won't work. I'd be happy to offer more opportunities, but I don't want to take all the time because I know we're at 11:38.
And Beth, I not to be on the spot, but I know that you've, done also, some of your work is also focused on mental health consultation in early childhood settings. I just didn't know if there was anything you wanted to add to this particular topic.
No, I was going to, and I want Khalid to have a chance to talk, but I was going to add that I think there's a huge opportunity. I know you all are going to hear about the suspension and expulsion prevention work that the state is doing. And I think, again, going back, not to beat, I won't use that frame, but not to repeat myself, but I think the need for more diverse pathways for culturally specific and linguistically specific providers and professionals in that field, and thinking outside the box. How do our community health workers do that work? How do we support so families have someone who looks like them, who speaks their language, who can develop a relationship with them, who maybe hasn't come up through our traditional university systems for becoming a certified mental health counselor or whatever. There need to be more opportunities, especially for the 0 to 5s. And I think that's where the early childhood mental health consultants, although there's not nearly enough of those, huge gap overall, especially in terms of communities of color and linguistically diverse early childhood mental health specialists. So I would just say invest there as well as other places.
Lee?
Thank you. I want to thank the panel for your very thoughtful input. I think the thing that rises to the top for me is the crisis that Colleen articulated, and we've been talking about it as a council for the last year, the heightened need around behavioral health supports. I think there are a couple things that Colleen mentioned. So this is more addressing council like us than our panel, but I think I want us to figure out how we address the fact that the child complexity data might go away, and that there's not funding to support the shepherding of that data. That data identifies our lowest income, highest risk children in the state of Oregon. And for us to not do anything to intentionally support their having access to supports, even though we don't have the workforce we need, we're not doing the basics to make sure that they have what they need. I just think it's unconscionable. We have increases in young suicides. I heard Jeff talk about the fact that he talks to adults or older youth who have all these issues that started earlier. The fact that Bomber invested all this money and didn't even take into consideration 0 through 5. If we don't do this, who will? Because it's not happening and things are not getting better for our most vulnerable children. The 23,000 children of incarcerated parents who like that, those numbers should keep all of us awake at night. So I guess I feel this really heavy sense of like, as a council member, how do we do something? And how can we be intentional, as Colleen articulated, in weaving together the systems, in incorporating this within our strategic plan of Raise Up Oregon and ensuring that something is done? Because if we're in the same place next year, it's shame on us, I think.
And Anne, I see your hand is up.
Yeah, I was actually can I pick up, and I was gonna say something similar to Khalid, but I was gonna add to it, because I think what I'd like to weave into it, Jeff's point about the challenge is implementation. We have to be able to pick something and understand, we have to be able to implement. We can, and so, and then I want to pick up Beth's point about how, if you can make the system work for the most vulnerable among us, you are lifting lifting all boats. You're improving the system for everybody. And so by weaving those 3 points together, the point that we have an incredibly vulnerable group, that, as Colleen reminds us with the health complexity data, that if we can figure out how to get the system to work for them, that will be an inroad into making the system work better for everybody. And Jeff's point that we got to show it and implement it well somewhere in order to get the ball moving. To me, those 3 pieces fit together into some kind of an image of something that we as a council could be promoting. So I'm just so grateful for the 3 of you, your incredible contributions to all of our research base, our practice base, and our policy base, because you really help move things forward. And it's an honor to be able to work with you all.
Thank you. I have a couple follow-up questions. The first question will be for Colleen and then Beth. I know you guys both have already spoken to this a little bit, but equity is a significant concern for the council. And what are your thoughts regards to council's work in Raise Up Oregon?
Yeah, I looked at the beginning part of yours, and I have to just elevate one issue that does keep me up at night a lot, particularly given how our systems work. So I direct a statewide organization, and the best part about that is I get to work across the entire state. And the barriers and gaps I've noted, they exist across the state, but they are exacerbated and amplified by the zip code that you live in. It is now predictable to me. I ask it every time I start working. So I work in communities, so that can be at a county level with early learning hubs, with what they reach, CCOs. It is now predictable that I'll say, have you ever looked at it within your region? Have you ever looked at it Douglas County? Have you ever looked at it for children that live in Roseburg versus children that live outside Roseburg? Northwest Oregon, have you ever looked at it for kids that live in the more rural parts of the county versus not? Katie, to the point I just made, have you ever looked at it by Jefferson, Crook versus Deschutes? Because right now you look at it overall. And the disparities and then the inequities that exist for children that live in more rural parts of whatever region you talk about are persistent. And then when we map on the services that exist, they don't exist in the very places that we most need them. And so I can't emphasize zip code enough. I think often people think, oh, you just mean rural or not rural. And I do mean that, but I also mean like within rural, and you look at the pockets. That's just a really important place that I would highlight. And then we've just talked about it, but I don't think you can achieve health equity unless you look at health complexity. You have 18.5% of publicly insured children, 25% that have a medical condition that indicates special health care need that are birth to 5. You have 28.4% that have, that's 38,000 kids who have 3 or more social complexity factors that are aligned with ACEs. And you have 18% of children, 1 in 5, who have both. I don't know how you achieve a health equity goal unless you focus on those two populations. And I think you have data that could help you use targeted universalism to really focus on some of those most important populations that go beyond some of the culturally and linguistically focused services that I just saw.
Thank you. Beth?
Yeah, thank you. Part of me is also wanting, I have my comments, but I also want to just add on to what Colleen was saying, that again, if you add on to that issue of zip code, the issue of race, which shockingly, we just did a report, or not just, but we've been working with state data systems. A lot of state agencies and local communities do not have data, good data related to race, ethnicity that allow us to put that overlay in, because in our rural communities, there are a lot of children of color. And if you overlay the rural issues with the racial issues and the systemic bias against children of color, families of color, you're really talking about listening to the margins. So just to add that, and also to add that we are not going to be able to take on looking at and being accountable for moving outcomes for kids, these marginalized communities, unless our data systems can actually have good data that allows us to disaggregate. Not that that's the answer and the end all be all, but it is a starting point for understanding and holding our systems accountable. I did want to spend like 1 minute. I know we're getting close to and running out of time, but to make a point specific to the early childhood sector, although it speaks more broadly, I think, to other sectors as well, which is that in terms of equity, I talked about this issue of equitable access and how that's not really defined. But then, of course, the question turns to access to what, right? You have to have access to something. And what I saw as a missed opportunity there was to really name not just culturally responsive services. We have this where they want families to have access to high quality, culturally and linguistic responsive services. I saw that probably at least 7 or 8 times in the plan. I think we can spend a lot of time investing in helping white people learn to be culturally responsive, and that's not a bad thing. But we also need to invest at the same time the way actually that we've invested in our Early Childhood Equity Fund grantees into those culturally specific and culturally linguistically specific programs that are designed by and run by those communities. They really offer a culturally sustaining and affirming type of service that is at the core of what we hear families say over and over they see as quality. Like that issue is not a separate add-on piece for families. That issue is at the core of how they see early childhood quality. And we really not like put targeted investments in the plan or targeted prioritization for culturally specific services. The only place I saw that come up was ODHS. So shout out to ODHS around family pres, although there was also language that was culturally specific evidence-based, and there's just not very many of those because the way they define evidence-based is the way our federal government has, which is based on very white dominant standards of research. So we have a long way to go in terms of developing culturally specific programs and investing in that workforce that's needed for those programs. So we're not going to have quality, culturally specific or responsive work providers or services until we get real strong investments in a culturally diverse workforce. So equity issues.
Thank you. And Jeff, can you shed any light on family and child perspectives on early child issues to inform Raise Up Oregon?
Yeah, thanks, David. If I could first just reflect a bit on Callie, your comment about we need to do something, and I'm really hearing that. And you know, for me, I would say that you all are doing actually something remarkable. This pause a moment. This is a really heavy lift. And so it's for me, this work is what you're developing, and its promise is inspirational. So you're doing something, and I think many in the U.S. are watching, and so it's, I think about then the tension between thinking about the arc of time and the immediate need. And so we do have immediate needs. I agree that we have a health crisis, and so there's an immediate need. And so do we have the will right now in this moment to concurrently attend to the immediate need, even as we invest in the arc? And so that's where primary prevention and all these systems change. We have this incredible opportunity in Oregon. And part of the reason I'm hopeful is this is aligning well with many other efforts nationally. And, you know, there's synergy. And so there's that. Just that as a reflection. And then to the specific question I'm going to just sort of be simple about this. So the doing this isn't simple. I wonder, how does it feel to be in this system? Both as someone who is building it, y'all and others, to be in it. How does it feel? What does the support look like? And then how does it feel to be like a user participant? We might call that individual a client or a patient, but a user participant. How am I treated? Did it help? So as we're building it, and these things, of course, take time, returning where to ensure that the current service at least is connected, supported. I can walk away feeling, whether I'm, again, in the system building it or user participant, is this meeting my need? Do individuals have the best sense of what I believe I need? And is that the central question? And as I walk away, do I feel seen, connected, heard? And we can be leaned into that. And so what is the soul of Raise Up Oregon? And every child, definitely. And, you know, every family for sure, definitely. And so I wonder about every space. Is that a part of this? What's the space for, again, those building this, continuously improving it, and those receiving and participating in services? And so if I could just, I want to end with that in mind. My final comment here is, these are just a few quotes from incarcerated Oregonians when asked, how do we prevent harm in childhood and support families? Just a few reflections. We have many. Here's a few. It needs to be okay to admit it and okay to seek help. There is so much shame, embarrassment, and fear involved. Reduce the shame and address the fear. Take away the negative connotation that comes with not being sure what to do. And the idea that the community will reject you is the heart of the silence. So.
I want to thank you all so much. We have, I'm sure we could probably have a much longer conversation. We have about 6 minutes left. If there's any just follow-up questions, comments from the council. I know there's not a lot of time, but Subin?
I think I have a comment or kind of a reaction to a lot of what Beth is saying. First of all, thank you so much, Beth, to pointing out veiled language and how it can be a disguise for or a code, as you put it. I wanted to just express appreciation for that. The other thing that I didn't want to lose sight of is you mentioned a lot about family participation and ownership of the system kind of being key decision makers. And Jeff, you talked about like the arc of time and it also needing to invest in that in addition to what immediately we need to get done, next year, right? And I see family participation as investing in, in the immediate, yes, but I see it as an important strategy in terms of the arc of time, right? If they are owning and participating in it And I think that will grow over time. So I wonder about some of the process metrics that we might think about in terms of, you know, in this, as we start to invest in that, what does that look like? I thought Jeff asked some really great questions that we could probably apply to many arenas of the plan, right? What does it feel like for families to participate and share in the governance and the decision-making? And if we look at those kinds of process metrics towards, you know, this kind of longer term goal of ownership of the system, feeling like it's a system for them, by them, you know, I think that's an important thing for us to consider.
Just a quick response to that. Thanks, Subin. Nice to see you. And I do want to say, in our own research, when we have invested in the time and development of family leadership for the research pieces, it's a lot slower moving. Like, let's just face it, it's going to take time. And the council and our worlds tend to work on deadlines. But I think, to your point, taking the long view and asking, when can we just start it? Start somewhere. Don't worry about it being perfect. Just make the investment and make, more importantly, the commitment to the value of family leadership directly at the state level. I think that's really important, knowing it's going to be slow, knowing it's going to take a lot of relationship development and trust building and all the things.
I think we still have time for one or maybe two more questions from the council.
David, I would just emphasize what Jeff mentioned right at the end there, that the sense of shame and what we can do to eliminate that sense of shame. That's so much part of people who've been traumatized, people who are struggling with substance abuse issues, etc. I don't know how we embed that in the document, but I think that's central. It really is central that if we can make progress on that and let people know that they are valuable, that every single person is valuable, I think that would be a good piece to embed in the plan.
Can I just add one food for fodder as you think about that? I can't tell you how much I appreciate that, because I look at families, children whose parent has access substance use disorder, mental health services, or incarcerated. Those are actually the 3 top predictors of child welfare involvement. And if you go back to why, it's because we don't have the safe supports to keep them to their North Star, which is their kid. We're so focused on, like, get a job, or, you know, you talk to most things that are like post incarcerated and it's never focused on their kid. And then we wonder why they stay in these cycles. And it's because our systems don't work well. What's been fascinating is when you look at those children that have those 3 factors, highly correlated with cost, highly correlated with lack of ability to start kindergarten ready, highly correlated with child welfare, a major chunk of them are also on Medicaid too. We're just not treating them like a dyad. We're saying, parent, you do this, this in order to keep your kid. And actually, in telling them to do this to keep their kid, it's distracting them from attaching to their kid and feeling like a part of a community. And so I think we have this, like, really nice, ripe opportunity to have a dual impact on both the adult and the child in a way that addresses what I heard in terms of inclusion and community and isolation.
Well, again, I just wanted to thank the panel so much for joining us today. So just deepest appreciation.
Thank you. It's been a pleasure.
Yes, on behalf of the council, I want to also say a huge thank you for being here today, but also I can tell from this conversation discussion, each of you spent a lot of time prepping for this 1 hour because you know our plan really, really well. So I appreciate all of the investment of time that you've put into making this a very meaningful conversation. And just a warning that some of us may want to follow up with you to get some input, like on values and defining equity, et cetera, and some of the stats that you were throwing out, Colleen, and Jeff, your great work around child abuse and neglect. So thank you all very, very much. And council, we will take a 30-minute lunch and stretching break and then come back promptly by 12:30, and we will start on an update with our suspension expulsion prevention program. So thank you all. David, nice job facilitating.
It was a pleasure to be to be there with those panelists. So
They're amazing, amazing people. All right, I think we are coming back. Wait for a couple more people to jump on. Alyssa, are you going to take the lead in this next section? No.
Nope, we've got the team all primed, I think. But John, if you want me to say something, let me know.
Oh, there I am. I was going to say, you can say all the things, but.
Okay, so who's going to lead off? I guess that's my question.
I'll start in, Sue, if that's okay.
Okay, that's what I needed to know. So let me just wait one more second. I know George has a conflict this afternoon, so he won't be able to join us. But I think the rest of us are back again. Wow, what an amazing morning we had. Incredible input, such great work being done all over the state. It's exciting, a little daunting, but it'll be fun to follow up with more conversation. So I just want to see, Remy, has anybody signed up for public testimony? Because this would be their opportunity to speak.
We do not have any signups for public testimony today, but want to share the opportunity that there is a public comment opportunity closing this Sunday, April 30th, to provide feedback for the Raise Up Oregon 2nd edition. And you can find more information about that on the Early Learning Division website.
Okay, great. Thank you, Remy. Yeah, we've had great input from the public, just FYI Council. So besides our hubs and partners outreach, we're getting input through our website as well. So it's going to be quite a document. All right. So next is going to be an update on the Early Childhood Suspension and Expulsion Prevention Program, which we've been talking about. It's, I think, comes up at every council meeting as sort of an aside comment. And now we are delighted to have it be front and center for us. So I understand that John Reeves is going to lead off for us, who's the Professional Learning Director for the Early Learning Division. So John, welcome back. Good to see you again.
Thanks, and really appreciate this opportunity. Thank you, Chair Miller and members of the council. Would it be important for all of us to say who we are for the record, and then we can just kind of present fluidly after that? Would that work?
Sure, that's a great idea, John, and we can welcome all of you.
Perfect. So I'll start. As you mentioned, I'm John Reeves. I'm the Professional Learning System Director at the Early Learning Division. I'll turn it over to then Katrina, Giovanna, Mandy, and Dahlia.
All right. Hello, everyone. It's great to be with you again today. I'm Katrina Miller, the Infant and Early Childhood Mental Health Specialist with the Early Learning Division.
Welcome back.
Thank you.
And Giovanna.
Yeah, hello, greetings, everyone. I am Giovanna Giles. I'm the Research Analyst with the Suspension and Expulsion Prevention Team.
Awesome. Welcome.
Hi, everyone. I'm Mandy Davis, Director of Trauma Informed Oregon here at Portland State University.
Awesome. Welcome, Mandy.
Good afternoon, everyone. My name is Dalia Velo. I'm an assistant professor at PSU, part of the Trauma Informed Oregon team, and I also teach in the Infant Elder Mental Health program in the College of Ed. Thank you.
Awesome. Welcome, Dalia. All right, great team we have with us today.
Yeah, wonderful team and some wonderful new updates to share with the council. And it sounded like Remy, were you already on it? Thank you so much. And if you wouldn't mind going to the next slide. Just wanted to frame that we're here today to provide some updated details on the development of the Early Childhood Suspension and Expulsion Prevention Program, and provide information as a follow-up to the letter that was provided to both the Early Learning Division and the Early Learning Council from community partners on February 20th, and really be able to provide more details to the Early Learning Council on the work that is underway. And so between some information from our ELD staff members and then our trauma-informed Oregon partners, they will also be able to share the work that they've been leading and what's going to happen in the short term in the next couple of months. And then we want to leave some time for questions and discussion with the council. Next slide, please. And I will turn it over to Katrina to take the first few, and then I'll be back. Thanks.
Okay, thanks.
Thanks, John. So not to spend a lot of time on this slide, but it seemed like an important piece to note. Like, these are from kind of a review of literature, of policy information. These are kind of the big 6 drivers, root causes behind suspension and expulsion, why it happens. Multiple, like, complex system level factors. And so an effective response to suspension and expulsion has to address as many of those as possible. So next slide. Many of you are probably familiar with, and I'm going to put the link in the chat, but many of you are probably familiar with this report that came from the Children's Equity Project, authored by Dr. Rosemarie Allen and Dr. Chantel Meek, and some of their other colleagues. But this is, they're presenting what they're calling a holistic framework for addressing exclusionary discipline. And they're identifying all of these factors as things that an effective response to preventing exclusionary discipline needs to address these things. And fortunately for us, fortunately for John and John's team, shall we say, many of these things are things that are addressed or impacted by professional learning strategies. Not all of them. Professional learning doesn't have a direct impact on teacher compensation, but many of the other things, there is some connection to professional learning or some influence by professional learning. So with that in mind, we've been thinking about how to really embed suspension and expulsion prevention practices throughout all of the things that the professional learning team does. So instead of getting just a few of us working on suspension and expulsion, you get a whole team, a bigger team of us working on suspension and expulsion. So I'm going to hand it back to John, actually, and to talk a little bit more about what some of those professional learning strategies are.
Next slide, please. Yeah, as Katrina was mentioning, there's a number of areas that we're investing in within our professional learning system. And the work of the Early Childhood Suspension and Expulsion Prevention Program requires true alignment and coordination and leveraging of these existing investments to support early educators and address those root causes of suspension and
John, we can't hear you.
We heard your exasperated sigh, John, so maybe you're back up.
Am I here?
Yeah.
No, you are.
I just got told my internet is unstable, and of course, that hasn't happened in weeks, but it'll happen now. So apologies.
It's okay.
I will. So you probably didn't hear anything I said when I started going, other than a exasperated sigh.
We heard most of what you said.
Okay, well, I will continue on. So as we talk about the early childhood suspension and expulsion prevention program, program doesn't truly represent it. It's larger than that. It's really a range of strategies supporting early care and education programs with their early learning environments, children's social and emotional development, thinking about how we embed things into our continuous quality improvement systems and into our quality recognition improvement system that supports suspension and expulsion prevention. Thinking about and working with our training and technical assistance providers and our coaches with the work and the relationships that they have in communities. There's inclusion, training, and consultation and consultants that are available. And we really need to think about how we're creating accessible pathways that support ongoing education of our early educators, support their wellness, and really think about how we develop other opportunities to bring new people into the early education workforce, prepared with the skills and competencies that support them in serving all children in their programs. And so prevention of suspension and expulsion is all of these things. And we really don't want people to think that it can be contained in just one program or in one relationship with an early care and education provider. Each of these component areas are necessary and vital to a full system approach. Next slide. And just to give you a closer look at some of the workforce, this is just some of the workforce that is providing training and technical assistance, but these are positions that are funded through the Early Learning Division and that provide training and technical assistance. We have infant toddler specialists, quality improvement specialists in childcare resource and referrals. There's coaches and mentor coaches supporting those coaches and inclusion specialists all working throughout the state in different communities. So there's a sizable number of key partners here that we are going to be working very closely with as people within the system that are going to support the early childhood suspension and expulsion prevention work. And as we build the program, there are other technical assistance partners and interventionists in communities that we'll be coordinating with amongst this group of individuals, but really focusing on reducing the need for more intensive interventions. They will be provided with the training and the tools, common approaches, language, and aligned practices to help children and adults to be successful. Really, the training and technical assistance system is a component that's focused on helping dialing down the need for rapid response systems, because they'll be helping to install the foundational knowledge and practices, working with early educators before things escalate and before they need to request additional supports. Next slide. And I will turn it back over to Katrina. It's a tag team.
Thanks, John. So when we're talking about embedding suspension and expulsion prevention practices in the system, what are we talking about? Well, here are 6 big bullet points, and truly each one of these could have its own slide or multiple slides. There's a lot of content within each of these headings. So when we say equity and inclusion, we're talking about training, coaching, communities of practice that are on racial equity and on addressing implicit bias and promoting culturally responsive, culturally sustaining practices. When we're talking about inclusion, we're talking about what are those strategies that promote the inclusion of children with disabilities in any given early childhood education setting that they show up to. When we're talking about nurturing and responsive relationships, each time I put this on a list, I sort of think like I wish this was a given. Wish this was a given that we didn't need to focus on more. But in truth, relationships are hard. They're hard among grown-ups and family members. So it's also hard with children and with families and with the stresses of being a caregiver. And sometimes it's hard to know how to operationalize, what to do to create a nurturing, responsive relationship. And sometimes it takes not the what to do, but the reflective space to say, here's how I need to show up for this infant or this toddler or this preschooler or their parents, their family members, whoever their caregivers are. And nurturing responsive relationships, high quality supportive environments, social emotional skills, addressing behavior, none of those, let me say it a different way, all of those have to be done from a perspective that is culturally responsive and culturally sustaining. Because nurturing responsive relationships aren't going to be nurturing and responsive unless they're also culturally responsive and culturally sustaining. So as you can see, there's a pyramid on this slide. What we're really talking about is pyramid model practices and really looking at kind of the different levels in this pyramid. How do we support those nurturing responsive relationships, high quality supportive environments? How do we make sure that all of our educators have the skills and training and capacity that they need to support children's social emotional development, to support children's positive racial identity development, a whole lot of things. And let's go on to the next slide, which kind of continues this theme. So this is kind of a tie-in from some of the information that John just shared in the prior slides around who are the technical assistance professionals? What are the roles that currently exist in our system? And there's probably roles beyond what's listed here. And also the on the right-hand side of the slide, those aren't roles, but they're kind of systems or infrastructure that are part of our system. And you can kind of see, now in truth, there's not a hard line between those different levels of the pyramid, right? There's flexibility. What's really falls within a targeted social emotional intervention, what falls into a tier 3 intensive intervention. So the lines are representative rather than technical, shall we say. But all of these kind of systems and roles are, you can see a lot of them designed that support the tier 1 and tier 2 of the pyramid model. And we don't have as much infrastructure. We don't have as many roles to support that kind of intensive tier 3 intervention. Fortunately, we have our partners at ECSE who have a lot of skill and capacity around that for the children who are identified with a disability. We also have our small but mighty Inclusive Partners team, and they are small but mighty. There's only a few of them to go around the whole state. So what we don't have, when we look at all of these kind of existing infrastructure, the planned strategies for preventing suspension and expulsion, the largest gap that we really see is infant and early childhood mental health consultation. And Remy, there it is. I don't know if you saw that, it's just little, but we just added infant and early childhood mental health consultation there at tier 3. So at the same time as we're working to coordinate and align all of the services that exist to embed pyramid model within all of those, we also are building the infrastructure for infant and early childhood mental health consultation. Let's go ahead and go to the next slide. It kind of continues that theme. So infant and early childhood mental health consultation, it's not currently available in most areas of Oregon. And particularly, it's not available outside of Head Start or Early Head Start, with a few exceptions. So it's something that we're working on developing in partnership with organizations that we're calling regional service providers to be identified. But now I'm going to jump back to the left side of the slide. Infant and early childhood mental health consultation is an evidence-based strategy that's been shown to decrease rates of suspension and expulsion. It's been shown to interrupt the impact of implicit bias, to increase reflective capacity of educators, supports educator well-being. Educator stress and depression is one of the drivers of suspension and expulsion, and mental health consultation helps address that particular piece. It improves children's social emotional functioning, outcomes for children, promotes healthy relationships in all directions, from educator to child, child to child, educator to family, like all the different possible connections that you can draw there, and it improves classroom quality. So we're working toward releasing an RFA in May, and with hopefully these timelines all go smoothly, that then we would be selecting grantees approximately July to August, contracts executed August to September. We anticipate, because it's not available currently in most areas of the state, we anticipate that some organizations, some regions will end up with planning grants, whereas then some regions will probably be ready for implementation grants, get the funds, hire people, get ready to go. And planning grants, we're really seeing them as an opportunity to, it slows down how fast the mental health consultation will get out into the field, but it will have a better long-term kind of sustainability, long-term outcome within our system, to take the time to plan and think and make sure we're ready. And I think I'm tossing it back to John.
Hopefully that gave my internet time to catch up with me. So just really wanted to stress around when we're thinking about a coordinated system response, it really needs to start with this concept of the warm line, where the early educators that are out in our communities have a place to submit a request for support. And then on the back end, there's an opportunity where the training and technical assistance professionals, the coaches, the consultants, and the workforce that we're working to build additionally with the infant and early childhood mental health consultants will be activated locally to respond. And this will, there will be opportunities for us to work to help create protocols and work with local communities so that they can decide who responds to these requests, focusing on existing relationships they may have with early education programs, where there may be trusted representatives from communities that are requesting the support, and what types of expertise may be required to respond to the specific needs that are addressed by early educators that are requesting those supports. And so the coordination will continue based on who's sort of the primary to go out and respond. But we imagine that as needs continue, that there may be warm handoffs to other professionals that may continue to support the work. And so as I'm getting ready to almost transition this over to Trauma Informed Oregon, part of the work that they're doing is really to help us understand from communities what is working and what needs to be done in order to make the services that programs receive even better. And so next slide, please. I'm going to breeze through this one because I am looking at the time and I want to make sure Trauma Informed Oregon has more time than I am seeming to give them. We want to make sure that this is just another depiction of all the things that we've been saying, kind of summing up that the Early Childhood Suspension and Expulsion Prevention Program has key work in these 4 quadrants or 4 areas of training and technical assistance, training for early educators, coordinating the system of supports, and then building the infant and early childhood mental health consultation statewide. And so without really going into much more detail around that, these 4 areas are going to be informed by the work that Trauma Informed Oregon is supporting us with, and by a representative advisory group that they will be able to speak to a little bit more around the next steps of building that. And so I will turn it over to Mandy, and thank you all for letting us give that intro.
Excellent. Hi, everyone. I'd already introduced myself. So Mandy Davis, she, her pronouns, Trauma Informed Oregon, here at Portland State University. And we can go to the next slide. Let it sit there for a minute. So first of all, thank you for letting us take a bit of time. We'll just take a few moments, I think 18 and a half exactly, but we'll see. And I just want to start, because I have to model the model, to just honor that you all have been in virtual space for a real long time today. So I just want to remind you to move your body, get some nourishment. I feel free to welcome all the things in the spaces and in the children and wingeds and whatever you need to kind of stay present for a bit. So I just want to, and I really just want to thank you for your service. I know many of you for years. And so it's a super important work and not easy to do in 4 or 5 hours in a box. Dolly and I are going to just take again about 18-ish minutes to talk a little bit about, I'm going to start actually just to tell you about TIO. So Trauma Informed Oregon, what we do, kind of how we do it, why we do it, and then move that into how we kind of are intersecting with this project. Because, and I'm looking at Peter in my box, who I work with often, when we think about the 3 R's, we talk about regulating and relating in order to get to reasoning from Bruce Perry's work. So relationships important, as Katrina mentioned. So I do want you to know who we are and how we approach work. So I'm going to start with that, and then I'll turn it over specifically about kind of the work we're doing with you all. So really quickly, Trauma Informed Oregon got started in 2014. We're coming up on our 10-year anniversary. I'm just going to breathe that in. It's been a minute. And we were really brought together with a group of folks. Oregon Health Science University, Oregon Pediatric Society, and Portland State University came together to figure out, it was really new back then, to figure out how to help organizations and systems across Oregon to implement, sustain, and evaluate trauma-informed practices and approaches. And no, 10 years ago, we were still like, what does that mean? So we were creating together how to help organizations do that work. And I'm going to ask for a bit of grace for just like 2 or 3 minutes from those of you who I know are steeped in this work every day. But it's so important that you know what I mean when I say trauma, and that you know what I mean when I say trauma-informed care, because excitingly, it's gotten very part of our everyday communication, but it's also important that we center it and know what it is and what it's not. So just real quick to remind you that trauma-informed care is, it's an approach. Sometimes we say trauma-informed approach, trauma-informed practice, trauma-informed care. But the real key here is when an organization or a system, and that's the important part, is it's organization and system level work. So when an organization or system understands the impact of trauma, and really quickly, when I use the word trauma, I'm really saying anything that overwhelms your ability to cope. We're talking interpersonal, community trauma, institutional trauma, experiences of racism, cultural trauma, so that's a big word. So we always ask people to kind of broaden their understanding of that word trauma, because it is not good enough. So trauma, scarcity, et cetera. So we can talk more about that any other time. So the organization or system understands that impact of trauma and then uses that to do better and to develop better practices, programs, and services. And what I mean by that is that we're going to see trauma-informed care show up in your human resource policies, right? We're looking at vacation policies. We're looking at hiring practices. We look at how we fund things. We look at what training, who needs to know what by when. We look at direct practice experiences, but we also look at like physical environments, coaching, access to supervision. So I'm just always want to give that expansive view of trauma-informed really needs to seep through an entire system organizational program. I also want to let you know, and forever's doing the slides, sorry, I'm all over the map. We're not even there yet, but it's fine. You can go back to the picture of the staff and I'll walk you through as we need to. I also want you to know, especially in Oregon, and I saw who you got to hear from with Jeff Total and et cetera, that that's such a great message that, you know, Sue, you were saying how much is happening in Oregon, because that's what's true with trauma-informed care. And what's fun is trauma-informed care spans across sectors. So we have human service sectors, but we also talk to park services, natural resource managers, first responders, hair salons, tattoo artists, neighbors, community. So I just say all that because I always want to, one of the things we've been, it's a model of ours, it's a principle of ours, is who's already doing the work. Maybe you didn't call it trauma-informed, but it's already out there. And so really trying to connect those things so that we can create a system that actually works for everybody, kind of across all the needs. So thank you for just giving me that minute to kind of put that in context. So think organizational change, think connection, and think how we name it. And kind of it's been around for a while. We just happen to call it trauma-informed for a lot of organizations right now. So here is a pictures of our staff. So just kind of a note that we have this, I am excited to have this amazing team to work with. There's 9 of us. That is the entire trauma-informed organ, from the person who does the billing to the people who develop content. And I say that because on this staff, we have specialists in disaster resilience and response work. We have people specialists in early childhood, cultural sustaining practices. We have a special interest in workforce wellness, especially the retention of workforce that represent populations, communities of color, and communities of culture. We have folks with lived experience in system involvement. We do a lot of work around the intersectionality of belonging, diversity, equity, inclusion, and trauma-informed care. And then I spend a lot of my work at the policy level, both federal and state. So we all kind of come to this with specialties and experience, but I just wanted to point out that we're small. I heard earlier, small but mighty, just a great description, I think, of this team. But we also kind of purposely are. So we do a lot of our work in partnership with communities. So we'll go to Southern Oregon Success and what have you got going on? How can we support you if we can? How can you connect you to another county or region so they can get support from you? So really trying to build those community connections is something that's pretty important to us. All right, I think we can go to the next slide. We'll see what it looks like. Excellent. Just so you know, we're primarily funded by the Oregon Health Authority, specifically the Child and Family Behavioral Health Unit through Health Systems. I think those are still all the right names today. But specifically through that group. We also have contracts and fees for service and kind of different types of funding through grants, contracts, but also so through the state of Oregon. We also work nationally and internationally with folks across all the work. Doing trauma-informed care. And we sit on a couple of national boards, especially around policy and practice. So I want to just kind of steep into a few things regarding what we do and kind of how we organize ourselves. So a couple, and again, it won't be enough time, but just to give you the broad brush of how we show up in the work and in the world. One thing we do a lot of is learning resources. So the lovely thing about being in a public-to-public relationship is that everything we do is free and available. So on our website, people have access to free training modules. We want them to use them and to take them and to modify them and adapt them. So we do a lot around training and education, but with the idea of building internal capacity, either within an organization or within a community, so that people really can have access to this at all times and places and in the way they need it to be done. We currently, with that learning resource, are really also evolving the learning of trauma-informed care. So from the beginning days, when it was kind of adverse childhood experiences, and then a beginning of what is trauma-informed care, to moving from there to really critically analyzing trauma-informed care through a diversity, equity, inclusion lens, to now trying to bring in and remind ourselves about healing and somatic practice and flourishing and thriving into positive experiences. So bringing that, so kind of continuing to evolve what we need to be learning about is something we're really focused on. Another bucket of work is community engagement, community building. So we, as part of our deliverables with our OHA contract, to be out in community. So what are you doing? What do you need? Can we bring in a training? Do you need a training? But more importantly, just listening. So I spent last week 3 days in Eastern Oregon. So I was in John Day and then went to Pendleton. I'll be in Malheur County in June for 4 days, just hearing what's working. What does your particular region need and how can we show up in that way? Then we do a bunch of work in implementation and policy. So policy for us is both federal policy as well as state policy, as well as an organizational policy and practice review protocol. So on all those different levels, we're trying to show up to say, how does trauma-informed care get embedded in policy in a way that's helpful? Because a lot of times it gets in there, but we don't quite know what it means or how to operationalize it. I always say it's really important that we remember trauma-informed care, I think, is an adjective. Like it's not, people need housing and education and medical care. They need it done in a trauma-informed way. So we often, by the how we do it, makes a difference. We also step in implementation, like how do we know this stuff is working? And we spend a lot of time in that. We just launched, like yesterday, our first ever implementation tool for organizations to be able to show that they're trauma-informed and then to be able to show change over time based on that. So we're excited to roll that out after a pilot process we partnered with the Implementation Lab on. And then, as you all probably know, we've spent a lot of time right now in workforce retention and wellness. So how do we keep a well-staffed, dysregulated people can't help dysregulated people? So how do we help a well-staffed really step into that and be retained in a quality way? So then our role on this project, and I should have said I didn't, just to know, put anything in the chat because you all have been in virtual for a long time. So if you want questions answered later, if you want to share emojis, feel free to do all that as a way to try to have relationship in this virtual world. So we come into this project to support ELD in establishing a racial equity trauma-informed strength-based program. But I think what's important I wanted to say is that this program has the opportunity to prevent adversity from happening, which is what we're interested in, right? Like the prevention of, but also to mitigate, and actually with the new research on HOPE research, to reverse the long-term impacts of adverse childhood experiences by creating positive experiences while also creating environments where people can flourish. So that's, to me, kind of the connection to our work, is that that's really exciting. And we want to be as helpful as we can be in any part of that process. So a little bit of context of TIO and TIC, feel free to ask any questions now or later about any of those things. But before I come back to you to talk about this specific scope, what we're actually doing for this direct project, I want to turn over to Dahlia to talk a little bit about the landscape of this sector as we step into this work.
Thank you, Mandy. Can we go to the next slide, please? As Mandy was describing, in every project, we make a conscious effort to look upwards to identify what is happening in the field, who is involved, who is connected with, who is affected by this project, and who is already in the community doing the work and what is their focus. So to immerse ourselves in the topic, we look at the entire Oregon landscape to identify programs, initiatives, and communities that we're already moving towards or could influence the project. So this slide is a representation, a non-exhaustive set of many ongoing statewide efforts. And what is interesting to see here is how the entities behind are represented at different levels. So in the state of Oregon, for this project and support or potential allies, so resources that we have work done across different levels, from local grassroots movements to statewide multi-agency collaboration. So this is a very exciting context that we want to keep in mind, and we try to keep in mind the entire time while we are supporting the program, because as Katrina and John mentioned before, this may sound like a program, but it influences and it has the potential to make a positive effect into many areas. And so there is a lot of really good work already happening, and we wanted to highlight that connection. Thank you, Mandy.
So we can go to the next slide. So the bubbles feel very calming to me to look at. So when we talk about what we're actually doing for this particular project, and I'm not going to read all these words because Dahlia is going to go a little bit after I share this. Dahlia is going to share kind of one of the projects and then a timeline of what's happening next. But there are really 4 areas that we're focused on in our contract regarding deliverables and areas that we're working on. One is community engagement, which is what you hear that we do a lot of in several different parts of our work. Specifically the advisory for RSP, which we'll talk about in the general advisory group, which Dahlia will be talking about after this. And then community engagement planning needs assessment. So that's area 1. The second area, these aren't in priority order, is that the standards of practice for infant early childhood mental health. And so looking at what are the essential, like who needs to know what by when, what are the essential knowledge and skill sets, how do people do that, what are the pathways, so really kind of working on that. And then support alignment and coordination, right, between all of those bubbles that you saw on the last slide. And then looking at central coordination. So compiling a collection of best practices of IEC, MHC, there's a lot to say. And then also to just aid and support the ELD and those who know this work really well in that design of the system for that ongoing feedback. So we're because that's a very much of a trauma-informed principle, is ongoing feedback. How do we know that we're kind of meeting the needs and that we need to evolve the work? And so that kind of thinking about that in design. So I'm going to turn it over for the rest of this conversation to Dahlia, who will step into what we've done and where we're headed next.
Thank you. Randy, we could go to the next slide, please. We wanted to give an example. So Randy showed you that we have 4 big buckets. In reality, those buckets are intertwined and connected. You can't just look at one without thinking about the other. So we're constantly going back and forth. Is this for this or this for that? But in particular, I wanted to tell you about the advisory group that we put together for RFP qualifications, because it was the first element in our contract, the first priority that we work on. It was a very short-term advisory group that was very specific with a very concrete goal of advising the ELD team on what are the qualifications these regional service providers should have. We had a group of 40 members, and they had expertise and representation in different fields and areas and regions across Oregon. We use a flexible approach to engagement. This means that we try to provide a range of options for every person so that they could engage with the work in any way that works for them. This meant being very flexible and offering one-on-one surveys, phone calls, texts, meetings, etc., so that we could help the person provide the feedback in the best possible way for them. We also were very careful to offer, and this is a practice that we typically do, offer end-to-end support to group members. From engagement, we're present and supporting every time they needed us or when they had questions, so that we accompany them. Because, I mean, personally, I was very grateful of all the amount of time that we got. After we finished with the process, we got nearly 50 hours of very interesting advice that we received. And so it was a very interesting process. The entire report that we submitted, I think it makes for very interesting reading, but we wanted to highlight a few elements that we observed. The first one is that we noticed that there was a high degree of consistency in the opinions and the advice. With a diverse group, and we try to have representation from different fields, you could expect variation or even some opposite opinions, but we didn't find that. We find a lot of consistency in the message that we receive. The second is that the feedback and the suggestions that the group provided were very clear, very practical. We were very excited for the ELD team because they received very concrete and useful help from the community to support the work they were doing. And then some key messages that we heard. The first thing we heard is like how important it is to center and work with each community in the developing of the plans for every region. Like, please don't decide for us, nothing for us without us type of feedback. The second thing was that the group encouraged the ELD to prioritize quality of services, real connections. They wanted to see real consistency, not just say that you are doing this, but prove in practice, provide evidence of what you are doing. And then they also had like hope that the plans the ELD will develop, they include the opportunity to develop skills for the local community. So interested in local skill development. And finally, there was a very clear message about searching for authenticity. Sorry, that's a different word for me, difficult. The real commitments, what is real behind the words? What do you mean and what do you do when you talk about diversity, when you're talking about equity and inclusion? Is that we want to see that this is not just words that you write on a report or on an application, but rather that you leave what you say that you care about. So that is the example. Brittany, can we go to the next one? The other element that we wanted to show you is that you heard Mandy describe the expected scope of our work. Here we wanted to add the timeline or a time dimension to this work. As you can see, we have 4 different buckets with many different elements. For example, in community engagement, we have really big topics like these are RSP qualifications project was very limited, but we have the plans of developing a general advisory group, develop a community engagement for the entire program, what are the needs assessments. So there are important things happening. It's a very big work. But what I wanted to show you is the time dimension. This means that we have many things that need to be developed, but less than a handful of months to develop them. And so what you will see, many of these activities, many of these activities are in the realm of planning or setting the base or creating the foundations, but they will imply that we'll begin to develop them, but not really provide them completed by the end of June. So for the next slide, what we thought would be interesting to show you is these are the same scope that I just showed you, the same timeline, but we wanted to show you in a different way. So as you see in gray, the RFP qualifications is a report that we already provided, something that we finished. We also created and submitted the infant early childhood mental health consultant, the standards of practice for these consultants, what qualifications they need to have, what they need to know, essential knowledge, skills, competencies. So that is something that was already completed. Our hope is that our next big task, which is this general advisory group, our hope is that when we get to convene this group, we will be able to change the dynamic of the work and center these culturally represented group of members of the community to inform the rest of the task. So the idea, our hope is that if we get to convene this group, and then this group will have the opportunity to influence what is happening next in the project. And I believe that's it. Thank you.
Really, really quickly, and thank you, Dahlia and Mandy. I did want to mention that we have in process to respond to a couple of different things. We have a study that's required in the Senate Bill 236 legislation that's due by September of 2024 on the use of and prevention of use of suspension and expulsion. And so we are working to finalize a contract with the Coalition of Communities of Color to be the entity that will support the development of the report and the study on those components, and then also helping us develop the ongoing evaluation and informing what we build around creating the data system that will support all of understanding the success of all the work that we're trying to achieve, whether it's through the coordination of entities or directly within the program and how it is working. And so other than that, I believe we're at the end of our presentation, and I see that there was a question from Kali about the report that Dahlia mentioned, and there are 2 of them, and we can work on getting those, getting the Early Learning Council access to those reports.
Okay. Thank you very much, John, Katrina, Mandy, Dahlia. Great background information. So Council, we'll go to questions and discussion and start with Peter.
Thank you, Sue. So yeah, thanks for the overview. Good information to have. Tremendous concern, John, that maybe you could address this. There's a couple of points on your earlier slides. You talked about a statewide pool of substitutes, which is a great idea. And then also talking about the process of doing requests for proposals for infant and early childhood mental health folks in every region. I just worry about the workforce. Where are those subs coming from, and who are these organizations that are going to be able to provide infant and early child mental health in every region of the state? I'm concerned we're building something that doesn't have a workforce foundation.
Coming off mute is a challenge today. I appreciate both of those questions, and with briefly on the statewide substitute pool, and we can come back to talk a little bit more with our Western Oregon University. The Research Institute is working on the development of that program and has started piloting in a few regions, and they are hiring the substitutes on as employees of Western Oregon University. And it is a challenge with workforce development, of course, and we're trying to think of ensuring that we're being mindful of getting substitutes in all the various types of positions that exist within the early learning field. And then Western Oregon University is working on methods to train and onboard and continue the development of those individuals. So if people are wanting to start as a sub, as an aide, and then work towards subbing as a teacher, Western Oregon University has a way to help those individuals continue their education and development. And then we also have some, and these are longer term opportunities, but there's some higher education scholarship programs, and then a consortium model that really works on recruiting people into the field and finding ways to support them in achieving degrees and higher education opportunities in non-traditional ways. So not just going to school during the daytime, but what are all the various ways that education might be provided in flexible ways and accessible ways in communities. And so those opportunities are coming, and they're another thing that we could share more information about in another session. And I will also mention, when we get to the even larger question of the specialized requirements of being an infant and early childhood mental health consultant, there are hopefully one of the wonderful opportunities in the Higher Education Coordinating Commission's budget, and in one of the bills is creating a scholarship, a higher education scholarship opportunity that would support anyone who's working in early childhood and people who are interested in coming into early childhood. But if you're a consultant or a coach or a quality improvement person, or you're wanting to get into that part of the field, that higher education scholarship would be open to those individuals too. And again, that's longer term. And then the thing that I would like to mention in the report that Trauma Informed Oregon worked on our behalf, related to the skills and competencies of infant and early childhood mental health consultants, they proposed a tiered model of helping, sort of a grow your own model of getting people into the field and working towards the sort of ultimate qualifications as consultants, but ways for people to get in and perform the work and be supported to do the work ongoing. And so that is a brief explanation. And Dahlia, I would lean to you to say anything more about those recommendations if.
Okay, let me just interrupt. We've only got not much time left, and we've got three other.
Okay, he asked the biggest question. Well, one of the big questions. Sorry.
So, okay, do you want to wrap up anything else, John, or can we?
I can wrap up there. I doubt it fully answered Peter's question, but there's a lot in that one, and I appreciate the question.
Yeah. Foundational is important. Subin, and then Anne, and then Kali.
There's so much to respond to and react to. So I'm going to kind of pick and choose. First of all, I appreciate the complexity of the work. As I would, in the first few slides, you shared the Rosemary Allen, her work, and the wheel, and showing all the different components. Something that I'd appreciate is it's hard to do all of it all at once. And so I would love to see what's being prioritized, what is happening, what is getting the attention right now, and where are we on those different components, right? That would be helpful for me. So that's one thing. The second thing was something that I heard from that letter that we received back in February was a desire for more participation from community partners and people who were involved in kind of passing and creating the legislation, getting it across the line. And so I'd love to hear about that. And kind of, I saw kind of a slide at the end with the Coalition of Communities of Color, but I also wonder about other organizations and partners as well. And then the last thing, this is just more from personal experience. In Rosemary Allen's work, and I see it as well on the slide that you shared, we're talking about attending to teacher bias and people's own practices. And I want to make a distinction between knowledge skills that people have. You can go to a training and not decide to make any change. You can get lots of knowledge and not make any change. And then there's a difference between people sitting with the counter narrative, acknowledging their privilege, their bias, their participation, their complicity in it, making new decisions and creating actionable plans that actually change the material conditions of people. I'm sorry, I'm speaking a little bit from I guess, frustration, because I feel like I've been in a lot of situations where it always stops at, okay, we see racism now, we get it, and that's where it ends. And that's where it ends. And so I want to hear more about how people are actually going to make changes as a result of the investments that are happening.
Great point, Subin. Excellent. Anne.
Oh, I'll defer my questions for time to answer Subin's question, because that's very good.
Anne, you're on mute.
I'll just cede my time to responding to Subin's question.
Oh, okay. Does somebody want to respond to Subin, the points he brought up?
I think part of the response to Subin is an appreciation for highlighting the most important part of all this, which is how do we embed what you learn into practice, and really not just receiving information and saying, okay, I get it, but how does that operationalize? And I think part of the answer is I'd like to have our team rally around some of the main parts of what you introduced, which is, where are we at right now? What things are being prioritized? What areas of content and how are we going to approach this, so that it gives you a little bit more context for what's happening in the short term, and then I think the long term is how do we create observable change in the field. And I think that's not something I can do justice to in an answer right now. I'd look to other partners that presented if they have thoughts about it, but I think that's a hugely important question, and not one that I want to lightly glaze over.
Yeah.
Sue, if I can, just real quick, I think two things that I think out loud actionable is, one is I think that's a great question to bring to the advice. That question needs to stay in all the parts, right? The Coalition of Communities of Color work, as well as the advisory group. So I'd just like to see that question be a constant kind of question on the agenda as these groups kind of work.
Yeah. Good point, Mandy. That would be awesome to have that be right there. Kali.
Thank you. Well, first, I think I would asterisk everything that Subin said. So I have a lot of the same thoughts. And I actually wanted to take a step back a little, because we've had this day where we've been listening to a lot of people talk about what's happening within early childhood, and this crisis around social emotional well-being has come up. And I see it as very much interconnected with this work of suspension and expulsion. And so one thing that struck me, and I too appreciate the complexity of what's happening, but I didn't see an articulation of a vision, of goals, of a mission. It started with root cause, but not something we have to be driving towards something. And we have to be able to articulate what it is we're driving towards, because part of what we heard earlier is people aren't even aware of the extent of the crisis. And then when it comes to the suspension expulsion piece, you know, part of what's happening is both the implicit bias and the social emotional stress of the teacher or the educator in the classroom. And I didn't see that come up at all, really meaningfully. And I think to Subin's point, implicit bias is not bias people are aware they even have. And there's been, the Iowa study is the one that I point to the most, that showed that you just flashing an image of a Black boy elicited a fear cortisol response within teachers. Like that for 4-year-olds, like that to me is huge. So how are we taking that data and crafting a mission, vision, and work plan based on some of that reality, in addition to the social emotional crisis where children are acting out more? There is more trauma, there is more behavior. So I would love to see that intentional integration of those things. And then I would also underscore, I didn't see, and I don't want to, I feel like I'm being negative, but there's just so much writing on this. So it's coming from a place of really deeply wanting to see us support our kids and support the early learning spaces in which they exist. And when I look and see so much around the infant mental health and not enough around the other pieces, the guy earlier talked about how we have an arc of time and how do we address acute needs. I forgot his name, but the researcher from University of Oregon, how do we address acute needs while also addressing system needs? It seems to me that we need to think innovatively and creatively on some of the system pieces. And I didn't see that highlighted. I know that there's been a lot of talk about the innovative approach that the Zimbabwe grandmas and the research study that talked about people from community helping to support community. That was not reflected. If we put all our eggs in infant mental health, we will never address the problem. And it doesn't address the real, workforce shortages that exist. So I guess I would like to see innovation. You see it in housing, like we have a homeless crisis that's acute and we have a system crisis where we don't have enough housing. How do we take that logic and way of thinking and apply it to this context, thinking about how we could do things creatively with community to address the challenges? And that's what I hope for out of this. And that I think we're capable of if we put our minds and minds together on it. So I, as a council member, I want to be part of the solution. Whether or not I'm on the council, I want to be part of the solution. So think about how we can do this together in a creative way and think more systemically, driving towards a mission.
Yeah, really well said, Kali. And I think that would be a request or a plea that we would lay before not just the ELD staff and Alyssa, you and your staff, but also with you, Mandy, and Dahlia, as you think about your work and continue with it. Where can the council play a role in trying to move this and include families in decision making, and then make sure we're being responsive to what their needs really are? So we want to be a partner. I guess that's sort of a bottom line of this conversation. And I know, Mandy, you and your organization are working with several people on this screen. So that's also very exciting. And we just want you to know the council's here to support as well.
That's excellent, because it's also a conversation, to Kali's point, in housing. But I mean, I was just on a conversation an hour ago about a same type of system need around young people who are expressing things through aggression. And how do we have, like, literally the graph was, what's the system, what's the community, what's the family, what's the child, and how do we get this up from state policy level into family? So it's the conversation that needs to happen. So I'm all for it.
Okay, great, because you'll be a really key part of that conversation, Mandy, also. Okay, we need to move on to the last item on our agenda. Thank you so much, John and Katrina, for your work at the division, Mandy and Dahlia for TIO, and we look forward to partnering with you in your important work. So thanks very much.
Thank you so much. And I will just say, I know that was only the tip of the iceberg from the comments that were able to come out, and we want to make sure that we're working very closely with you all and that we have that advisory group helping us craft all of this work ongoing. So thank you, Sue, for the opportunity, and thank you all for the meaningful responses and questions.
Yeah, thanks, John. And let us know when the advisory group's put together. I think we'd be really interested just to follow that and see who's on it and kind of what's their timeline and involvement. So that would be great. Thanks. And Alyssa, thank you for your leadership in this. You didn't speak today, but I know you're very involved in it.
Yeah, and we'll talk more, Sue. I think how do we continue to talk about these complex issues in an hour or less, right? Like, it's not just with this topic, but I think this is something that as a council, we really need to wrestle with, because there is so much work, and the council has that cross-sector lens, and we can't make the progress we need to an hour a month and reflect all the complex nuances of this work. So I think that's an opportunity for us to kind of think about, how are we using this time to the best of our ability, but finding other ways to really be working on this collectively, to really get to the extent of this, because this is an under-resourced, disparate system that we're trying to build when we think of early childhood, and 5 hours a month to try to get at all the issues. We're not going to be able to do it the way we want to.
Yeah. Really good point, Alyssa. And I think, council, that's one thing I hope we'll have some time to talk about in May when we're actually physically together, and just talk about some other approaches, or, do we do just not consistent, but sometimes have in between council meetings, we'll just have a special topic and say, we're going to take 2 hours on this date to talk about suspension expulsion prevention program. Those who can join, but it's not an official meeting, but it's an information and discussion opportunity. So you're right, 5 hours a month doesn't do an early childhood system justice. And
yeah, I would just like to totally sort of support that, because whatever we can do to help create kind of an overarching vision for this and some kind of general strategy, I think that would be a great role for us, because I can see that this is hard. There's pieces of it, but creating an overall strategy is going to be really important, so that we can know how to plug in various things that we've learned from our field about what some of the best practices are. So I'd be really supportive of that, Sue.
Okay, yeah. Thank you, Anne. Okay, council, let's hear what's going on at the legislature. Hopefully some good news. I know Ashley has been on this call for the longest, I think, of all of these presenters. So Ashley, thank you for joining us. As you know, she's with OHA. Council, you have information that Remy sent out this morning that gives you some information in writing from some of our partners. So Ashley, if you'd give us the highlights of what's happening at the Capitol.
Yes, happy to. Hello, everyone. My name is Ashley Thurstrup. I use she, her pronouns. I'm grateful to be here with you. I'm the Interim Government Relations Director at OHA. And I'm here to just update you on some of the key OHA legislative priorities having to do with health equity, those that impact young children, maternal family health, and OHA's North Star goal of eliminating health inequity by 2030. Remy, I think yay, thank you. Thanks for bringing up my slides. All right, and I will be brief here because I know you have a lot, you've had a long meeting and you have more to get through today. So yes, here on this slide, just a quick update on 3 of the policy option packages related to building health equity infrastructure and implementing health equity. So these are all in the OHA budget bill, Senate Bill 5525, which is currently in Ways and Means. The first is about expanding OHA's infrastructure in order to really ensure that we are meeting that North Star goal of eliminating health inequity, and that's through boosting our team to support civil rights, investigations, universal accessibility programs, all the initiatives around diversity, equity, and inclusion, and then supporting community partners and providers to do the same and to make sure that communities are served appropriately and robustly. The next POP here is 403. That's the REAL-D and SOGI implementation POP. And this is really key for a core IT investment that's needed in order to collect this demographic data, race, ethnicity, language, disability, sexual orientation, and gender identity data. As you probably know, this bill passed quite a long time ago, setting us on the path to be able to collect more robust data systems and then be able to use that to drive equitable policy and decision-making for the future. So this is a key investment to support that work moving forward. And then 410 is the Regional Health Equity Coalition program expansion. So that would fund the second phase of statewide representation of regional health equity coalitions. And then I'll just also mention that there is a Bill 564 that's similar. It's also a Regional Health Equity Coalition expansion bill that was brought forth by the RHECs, and that's currently in Ways and Means. Great. Next slide, thanks. The public health modernization POP I wanted to highlight as well on its own. This is about supporting key public health priorities, including reproductive health initiatives, supporting local and tribal public health systems, along with community-based organizations representing communities most impacted by health inequity, to respond to future pandemics, fires, any sort of catastrophic public health events, as well as being able to meet any of the other public health needs within the public health system. So building on the infrastructure that was really developed through the COVID-19 pandemic and expanding on those short-term investments of federal funds that came through in order to continue to kind of enhance those strong foundational partnerships that have been built throughout Oregon. So the governor's budget included a $50 million recommendation. There are there's a lot of folks showing up or have showed up throughout our budget process in Ways and Means to advocate for funding for this program. And so I just wanted to note that. And yeah, it's again, still currently in Ways and Means. So this is part of that policy option package. Next, please. So a quick update on pharmacist flu vaccination for all. This is an OHA bill that we brought forward through a legislative concept developed pre-session. This allows trained pharmacists to give flu vaccines to patients over 6 months of age. The goal is really to expand access for working families, for people who really want to make sure their entire family can get vaccinated at a pharmacy, grocery store, et cetera. So this bill is moving. It passed out of the House to the Senate Healthcare, and we're just waiting for it to be scheduled over there. The next bill that's highlighted is Senate Bill 216. This is about confidentiality in race, ethnicity, language, and disability, sexual orientation, and gender identity. This bill was scheduled for a final floor vote on the House side today, and it just got moved over to tomorrow. So we're hoping that that passes through quickly. And this would make it so that REAL-D and SOGI data couldn't be requested through a public records request. It would be protected. And there's some other minor changes as well.
Okay, Ashley, I need you to wrap up.
Oh, sure. Yep. So everyone has, hopefully you have this information and you can look at it, look through it. And I definitely kept some notable bills at the end so you can take a look at those as well that are non-OHA bills, but very important to maternal health and family health. So thank you.
Okay.
And
thank you for joining us, Ashley. We appreciate your time. Kyle Thomas with HEC. Welcome, Kyle. Thanks for being here.
Yeah, hi, and thank you. Kyle Thomas. I'm the Director of Legislative and Policy Affairs for the Higher Education Coordinating Commission. In Ben's absence, I was asked to really just cover one initiative that we are tracking. That's House Bill 3561. This is a HEC and Governor's Office sponsored initiative The correlating policy option package here is POP 302. This is the bill that modifies provisions of the Early Childhood Care and Education Grant that have never been funded. This is the program that exists on paper, for which we hope there will be an associated funding this session. This particular bill clarifies that not just early childhood educators, but specialists in early childhood behavioral and mental health would be eligible to receive grants to cover their college expenses under the program. It appears well liked. It passed out of the House Higher Education Committee 9-0. It's passed the House floor on a vote of 42-1. Representative Neron in her earlier this session in her investigation about ways to incentivize individuals to choose early childhood as a profession didn't introduce any supplementary legislation when she discovered that this piece of legislation was out there. It's currently scheduled in the Senate Education Committee that has a public hearing on May 4th. That's next week. We've reached out to Alyssa and ELD to reprise our testimony that we previously delivered in the House Higher Education Committee, and certainly we encourage anyone here who's so inclined to make an appearance. The bill text is obviously not the challenge. It's the funding. It's scheduled at $5.2 million in the governor's recommended budget. Unfortunately, with the co-chairs framework, it is on the outside looking in. And of course, I think as everyone is experiencing right now, in advance of the May forecast, all conversations are essentially non-committal with regards to the ability of this to get into the final budget. It does, I think, face the challenge that it's not on the list of any of our traditional stakeholders, right? Those who go before the Senate or the Ways and Means Committee for Education on behalf of the HEC budget most frequently are not asking for this. Of course, they are asking for formula funding for higher education, other more widespread financial aid programs that we offer. So ultimately, it remains to be seen what the outcome of this will be.
Okay, yeah, I testified in front of the House Committee and on behalf of that, weeks ago, whenever that was. So we could certainly look at that again for the Senate. Won't be me, but we'll see. Okay, thank you. When did you say that the Senate committee hears it? Jake?
It'll be May 4th at 3 p.m.
May 4th at 3 p.m. Okay. Okay, yes, we would love to get that funded this time. So super. Kyle, thank you very much. Appreciate you joining us today. So Christopher, are you doing the ELD or David?
I think we can tag team. I'm happy to kick things off. Just want to probably the most important bill that we've been tracking this session for the launch of Department of Early Learning Care is also, I think, for most people, the most boring bill. That's SB 427. That's the bill that gives us the statutory authority to enter into interagency agreements, both with Oregon Department of Education and Employment Related, and with Oregon Department of Human Services, to continue to, for them to continue to play important administrative functions. So, employment related daycare will transfer to DELC on July 1st, but ODHS will still do the eligibility through one eligibility and perform a lot of other functions. We need the statutory authority to enter into those interagency agreements. We need that statutory authority before we enter into those interagency agreements. And as you can imagine, that makes the July 1st deadline quite daunting. The bill also will allow both ODE and DELC to continue to have access to the early learning account. That's important because the legislature allocates funds from the early learning account to multiple programs that will be administered by the Department of Early Learning and Care, such as the Equity Fund, Preschool Promise, but it also allocates funds for early intervention, early childhood special ed, which will continue to be administered by ODE. So the good news is really thanks to the leadership of Senator Steiner. This bill was really fast-tracked, moved really quickly through the Senate, the House, and I think Alyssa let me know that the governor has actually signed the bill this morning. So that bill is now law. And so that really important technical barrier for DELC standing up has now been taken care of. So that's very good news.
All right.
So
what was the number of that, David?
SB 427.
Okay, we can all send thank yous to Senator Steiner. Okay, other updates from DELC. We'll call you DELC now that you're getting official, Alyssa.
Chris, do you want to talk about 3435 and 3558?
Sure.
I think those are the other two agency bills.
So the two of the three agency bills are still working their way through the process. So we have 3435, which basically renames the Oregon pre-kindergarten program to the Oregon prenatal to kindergarten program. And part of that was around everyone is familiar with OPK. So we didn't want to change the name because for branding issues, but we also wanted to change the name to make it more reflective of the total services that the program actually provides. That bill, SB3 or HB 3435 is scheduled for a public hearing on May 2nd before the Senate Committee on Education. And then the final one is 3558, which is another technical bill. But this, in essence, it changes references in statutes. It eliminates the Office of Child Care and then includes the Department of Early Learning and Care. And this allows us more flexibility to be able to share information within our agency partners to make sure that we can share information so we can make all the correct decisions. It also prevents what's called stacking, where childcare providers could get together and to try to circumvent the licensing requirements. So those are some of the most important things that one does. And that one had a public hearing Monday, if I'm not mistaken. So we're kind of waiting for that to move through the remainder of the process. So those are the three agency bills that we currently have, that we're currently monitoring right now.
Okay. So yes, there were lots of other bills in our packets that are not those three agency bills. Peter, I know you care about one a lot, and I'm guessing there are a few others. Katie.
Yes, House Bill 3005. So the 100 million for capital facilities for childcare. Does anybody know where that's at? I've heard it's hit some headwinds.
Maybe Alyssa, since you've been working with the governor on that, maybe do you want to take that one up?
Yeah. Is this the Children's Institute bill you're talking about?
Yeah.
Okay.
I have headwinds though, Kali. I don't know if you have.
No, that's why I was like, wait, what? So, I mean, it's in ways and means. I think the challenge that we've shared is that it's mostly in lottery. It's almost all in lottery bonds.
Right.
Lottery bonds you cannot use for home-based care, and that's problematic. So we're trying to free up dollars to have some general fund dollars that would go into the fund that would not be lottery bonds. Lottery bonds are helpful to get out the door, but it's just there's a whole faction of the sector that can't use them. And given all the affordable housing and housing that's being constructed, it's a miss to not be able to do co-location of housing and childcare. We do have a lobby day next week, or the 9th, coming up for Children's Institute. If you'd like to join, this is our headline area that we're going to be advocating for. So welcome all council members to join in.
Great. Thanks for that, Kali.
Yeah, good question, Katie. Peter, do you want to mention yours? You may have several, but.
Well, we're focused on House Bill 2726, which would create an early childhood support network in Jackson, Josephine counties as a pilot for the state, involving using community partners to develop family success plans with the families that they work with. There's flexible funding through a early childhood support fund that community partners can use to help the families meet the goals in their family success plans. And then there's a child care support fund as well, which gives some flexibility to the hub to support sustaining the childcare system and then expanding it. And hopefully, again, we're developing something that could then be scaled up in the 2025 session to reach other regions as well.
Yeah. Thanks, Peter. You know, I thought about that today during many of our presentations this morning, talked about, you know, let's do something, let's get focused on something, show that it works, and then we can try to do the scaling. So I'm looking hopefully to that project as one possibility, Peter. Yeah. I'm not sure that's wood, but yeah. Because I think that's an approach that the council may want to really take a hard look at. So we'll be following that with you. We sure hope you get that $5 million.
So just so you know, we did kick off the network with $100,000 we were able to raise. So we're working with 70 families currently, and 8 different community partners working with 70 families. So we should have at least some preliminary data in the next several months on how it's working.
Okay, will you keep us updated on that, Peter?
Sure.
I think the council, it sounds like several of you have commented on, let's find some piece of this very complex puzzle and see if we as a council can try to make a difference. And that's partly because we're multi-agency. So we have a lot of the right players to deal with all of these root causes, social determinants of health, basic needs of families. I mean, many of them are at our table. So how do we leverage that kind of involvement and support? We'll answer that in May, I'm sure. So this was an amazing meeting. Well, I sure have a lot of takeaways on my list. One specific question. I am not available for the Senate committee meeting on May 4th at 3 p.m. that our HEC representative mentioned as far as trying to fund that scholarship program. We can submit testimony, I know, but I don't know if anybody wants to sign up to represent the council virtually for that hearing. And who knows if you'd even get called. Katie, you could do that? Super, thanks.
If somebody could send me the information, just firm it up, I'd be happy to, and a couple of speaking points. Yeah, I can do that.
Okay, thank you very, very much. We'd really like to get that funded this time. I think they had approved it in 2019, if I remember correctly. So they've just never funded this. So that's one specific. You know, we heard a lot about navigators today. And when I saw the diagram that I think it was Dahlia presented on the landscape circle diagram, all of those many circles that are involved in this whole suspension expulsion field, it made me think that trying to put together a similar diagram that had all of the navigators that are out in the system affecting early childhood and their families could be quite informative. Because we know, I'm guessing every agency partner we have has some form of navigator going on. But obviously they're in their own agencies and their own silos. So it's just a thought of, is that an area that we as a council could try to get our agency partners to help us with? Other takeaways from today that you all want to share for future agendas and conversations?
I would just like to say, Sue, that I thought this morning's meetings, both with the the Early Learning Hub directors and the researchers, were fantastic. They were chock full of information. They gave us really good ideas about how to be thinking about these problems and some strategies about it, including what you're saying about, navigators, and is that an interesting idea, or is there something that we can grab onto? And So I appreciated all the extra time that we had for that because it made it really meaningful. And I also came away feeling like the suspension thing is something that we still have to put our arms around and figure out. And there's some work to be done on that. And so I felt like this was a nice range of things that we as an early learning council should be thinking about, things that are really sophisticated, as well as things that are sort of nascent, and of course, some pressing policy and legislative issues. So,
yeah,
thank you.
Okay, thanks, Ann. Other comments, takeaways? We're all going to be together in Salem in May, which I'm very excited about. May 24th, I think, is the date. As always, we'll go from 9 to 2. The morning will be focused on all of the input that's come in on Raise Up Oregon, including what we all heard today. So David and Harriet are spending at least all Sunday and probably many other hours as well, trying to incorporate the information that we've been gathering. Also, they're going to that next level, as you know, under the strategies will be actions. So that's where the implementation is going to show up. So you won't get this new revised packet until the Friday before our May meeting. But I'm hoping you have nothing else to do that beautiful spring weekend and you can just read the entire packet and memorize this revised strategic plan, which will be very exciting. Staff is spending an inordinate amount of time pulling this information together for us. So I really want to thank Alyssa and David and Remy and your team for making this really a remarkable roadmap for the state and a North Star that actually other states are also picking up. So thanks for that investment. And we'll also do a home visiting system update. Peg and Peter will at, if not May, then in our June meeting. So unless someone else has some other closing comment, I would just thank each of you for giving us most of your day. And I hope you have a great rest of it and enjoy the spring weather. Okay.
Take care, everybody.